We have a number of things on the agenda today. Gonna vary as chair based on the number of people involved and timeline. So the first thing we're gonna do, we have Dr. Bobby Canero, if you wanna come forward and sit by one of the mics. We're gonna have a discussion. I think I'll have, I don't know if you wanna give some background. And just for, so everybody knows, this is day 13 for me. I've been self-quarantined, influenza A, but I was assured that I'm not contagious. I did wear a mask for the elevator, but I feel a lot better today. And so I think I missed out on a lot of things, but I think that was the right thing to do during this time. So, and my counterparts and our great staff carried forward. And so, but good to be back, but I am not contagious anymore. So, Jay, I'm gonna flip
Yes,
to you.
so Dawn, do we have the document that Dr. Canero sent to us? It's been a fast morning, so if you could have that printed off, that would be wonderful. I'm pretty sure I forwarded it to you this morning.
I have not seen it.
So we do need the board to see that. Dr. Canero, I apologize, but it's been a fast morning here. I have the document in front of me. I will forward it to all three supervisors right now. Okay. And Mary, you're getting a copy as well. Okay. And I'm sending one to Patrice Lambert and Tom Berger as well. Okay. You guys got your, and Dawn, if you're able to print that. But maybe what we'll do is verbally have Dr. Canero describe his offer of services to the Board of Supervisors.
You put it up, Dawn, now that we've all got it?
Yep, and Dawn can print it off, and yeah, actually you can share it up there as well. That's a good idea. We just throw it on the board. And this meeting is streamed live on YouTube. Does anyone want to check that? You're welcome to vacate the room and watch it on YouTube as well. So those are options. It's on the Dubuque County site.
Patrice, have you seen this? Okay. No.
Oh,
So
This would need to come under your purview. It's a request to have Dr. Conneru be
So
the
let's-
medical liaison for the county.
let's go ahead and read this then. I'll go ahead and read it on behalf. Dear Board of Supervisors, we are currently facing a historic challenge with COVID-19. We must proceed thoughtfully and expeditiously, utilizing the full expertise and cooperation of the healthcare professionals in our community to maximize testing, mitigation efforts, and treatment. Our state and city have a chance to be a model for public health. Hindsight would not look kindly on actions that are taken too late here. Moreover, as health professionals, we know that in the weeks to come, we are already at risk of overwhelming our fragile healthcare system. Currently, I believe that we do not have a strong communication bridge between our healthcare professionals and county government. I am proposing to Dubuque County COVID-19, I'm proposing to be the Dubuque County COVID-19 medical liaison. The scope of services and position would be to communicate to various members of the community and county government, including medical providers, institutions, Board of Supervisors, Board of Health, Emergency Management, county department directors, state and federal agencies. My services will complement the existing structure of the Board of Health and EMS operations. I would be an additional resource to provide advice and counsel to all the above parties. As a member of the Board of Health and local medical community, I believe it can provide positive interaction with the above parties and add further clarity in this time of uncertainty in preparation of the outbreak in Dubuque County. I see this as a team approach, and I am offering my services to this team. You can scroll up, please. My services include one dedicated day per week, periodic phone and Zoom video conferences through the week, available through June 30th, 2020, possibly longer on request. Immediately availability starting Monday, March 16th, 2020. As I have active practice at the time. I am open to conversation discussion regarding my services. Believe this service to be a community is of high priority. Thank you, and I look forward to working with you immediately. Sincerely, Bobby Canaro, Dr. Bobby Canaro. So, Dr. Canaro, any additional comments you would like to provide related to the statement and your offer of services?
You know, just to add, I think that, again, we're at a historic time right now. I think it's important that we bring together the best people suited in the healthcare community to tackle this. I've already talked to Dr. Viner this morning from infectious disease. In process of communicating with Dr. Powers. We probably also need to get pulmonary critical care physicians involved. So I think we need to have a really cohesive communication between our boards and the healthcare professionals in this community. I think optics is also really important. It's going to be really hard for us to enforce certain things within our community if they don't feel that we are in fact, having a cohesive plan. So that's why I thought that this particular position may add value.
Questions or comments from
Yeah,
the Board
discussion.
of Supervisors, or if you'd like to take over?
If, and I think, has there been any thought to compensation? I know we have some doctors on staff on a part-time basis now for other things.
I assume you're open to that compensation?
I'm open to that, and whoever I guess it is that works with contracts on this level, I'd be happy to talk with them.
Yeah, and I think that's would be the way to go, is that if the board would accept Dr. Canero's offer of services, we would have him engage with Dawn Sherman and work out those details, and that documentation would come back to the board this week. As normal processes do related to those items. But I would encourage the board to accept the offer of services, to move swiftly and include Dr. Canero in a limited capacity on the board. This gives the Board of Health, the director, the EMS, one additional staff member. I know there's been discussions of adding Assistant City Manager Terry Goodman to help on the team related to legislative components. I support that as well. So I'm very appreciative to anyone in the community in the professional status that moves forward and says, I'd like to help the government in the community at this time. So I will be supporting this.
I think we're blessed to have Dr. Canero on our Board of Health. I think this makes all the sense in the world to have a medical doctor at our disposal for his counsel and advice. I think, I guess I had to be the sourpuss about bringing up the compensation, but I think we can work that out, and I support this as well. Ann, your thoughts?
Well, I've known about it for 6 minutes. Nice to meet you. The proposal has, some of my colleagues have had the benefit of reflection, and I think we are in times where we need to listen, learn, and also give some thought. You are on the Board of Health. I don't know how many of those folks are here and how many of those people have met you. I don't know how that has been, but we have professionals, and obviously you are as well, who are working very, very hard with very little sleep, and I need to have them feel comfortable that their questions are answered, or I'm doing a disservice to highly trained people that are performing the function that the county's asked them to do. So, my hesitancy is that it's pausing to ask for time to read the document and look at what the implications are. I am not a supervisor who generally does things without knowing what the dollars are. I like volunteers a bunch, and I think that our Board of Health is filled with people who are volunteers and serve in endless hours in that capacity. It's not about the money, it's about knowing, it's about looking for what we can learn. So, I am not likely to support this in the next 4 minutes. Likely it will pass the next 4 minutes and it won't matter what I say, but that's where I am. We are going to meet again this week. I know you're working with my stakeholders, and unless somebody here is going to tell me we urgently need this, I have texted to see if our new liaison person is aware, Terry Goodman. I don't know if you've communicated with Terry Goodman.
I just found out about her role
Exactly.
today.
So we're all, it's all unfolding for all of us. So, that's where I am, that I don't think we need to race. I think we need to be proactive, but I do think we need to get the information that we have and make sure we know what we're doing and that we've consulted people. We're going to get an update about our EOC, our emergency management systems, which I think probably have changed since over the weekend, and community spread's been confirmed. So if this were going to happen, I would be more likely to even have the benefit of today's discussion to see kind of where we are. And, unless I have professionals that are in their capacity say, gosh, what's the harm? Or of course we should. Otherwise, don't perceive my hesitancy to be anything other than just trying to take the time to make sure we know. And I know you understand that as well.
So I'm going to comment on this. We met Friday. I was here by conference call. Just since Friday, a lot of things have changed. We now have school closings. We have a lot of folks here in the room to talk about how that affects childcare. So I don't think we can wait. So you know what? And I'm not offended that I didn't have this before I got here. Apparently Ann knows more about the Terry Goodman liaison thing than I did. I'm not offended by that. We have a 3-person board. So if 2 of us are together, it's a quorum. So we can't talk to each other ahead of time. So I guess I want to go directly as chair and ask Patrice and Tom Berger if they have issues with us adding a medical doctor to your team on a temporary basis to help get through this emergency.
He is on the team
I'm asking the question.
because he's on the Board of Health.
I understand.
I'll start, because we have a structure in place, and I'm not saying that we couldn't welcome more, because we are, such as Terry Goodman. But, as long, as your proposal says my services would complement the existing structure, that would be what I would like to see as a complement, not a restructure, not to remove or to place barriers of what we already have in place, but to be a team member of our existing structure that we do have. And it is. Even over the weekend, things changed rapidly. We had 2 webinars on Saturday, 2 on Sunday. We have another one tonight. We had one this morning. So it's, as long as we complement, then, but again, I'm just reading this for the
Yeah.
first time. So,
So,
and I haven't even visited.
Dr. Canaro, do you feel comfortable with her comments? And you'd be able to comply and work with Patrice and Tom Berger and other members of the Board of Health and Board of Supervisors?
In no way did I want to suggest that my role would be over, or surpassing any of the current structure. It's really to assist and communicate and to help bridge any communication gaps that may exist currently. I think that the current, being on the Board of Health, we meet once every 2 months. I think this position would require a lot more work, and that's what I'm willing to do.
Excellent. Chair, I'm ready to move for a motion.
I want to hear from Cheese.
Okay, thank you.
Having a subject matter expert to help us is, so fast. We worked all week where, things are changing. Once we get something ready to go out, then either the CDC or the Department of Public Health, so I think the more help we can get with people that know what's going on, it's just gonna be a benefit to us.
One other point I wanted to make, again, going back to optics, I think it's important for the community to hear a unified voice from a healthcare professional. And that's something currently we don't have, to be able to direct and communicate and articulate what our agenda is, our objectives are.
Would the commission be creating the agenda and the objectives, or would you be doing that?
No, the boards would be creating the agenda in collaboration with healthcare professionals, and then I would articulate that or communicate that.
And then just for discussion purposes, and I am allowed to talk to our staff and not form a quorum, but I think there seems to be consensus from the chairman of the Board of Health, Tom Beshin and Patrice and myself, that the Board of Health will start meeting with the Board of Supervisors twice a week. And I think we were gonna get to that, so I think it's all a good fit. And I think having Dr. Canero's expertise and in communication with his peers and counterparts is why I'll be supporting this. So I think the final, we'll still need to work out the compensation, but I think
Yeah, I think I'd.
normally we try to address consensus on moving forward.
I would just like a formal motion. I'll make a motion to move forward with Dr. Canero's offer and have him work with Dawn Sherman to complete any necessary service contract documents and have him effectively immediately in his service offering to the Board of Health and the Board of Supervisors.
Will there be more discussion?
There will be.
I will second that.
Okay. Motion's been made and seconded. It's open for discussion.
So could you give me better understanding of who you will link in specifically? Like, who are the medical folks that you think will bring to bear? What will you help us better understand?
I think there's three things that we need to, make a priority, such as social distancing and mitigation testing, and then also being able to prepare for when a surge does happen in this community. And to do that, I believe that we need to have a couple of experts that we're linked in with. As I mentioned, I've already been talking to Dr. Viner from infectious disease, Jill Powers, who's on the Board of Health. I'll be communicating with her, and I think we need to get one or two pulmonary critical care physicians involved, maybe from medical associates, one from Grand River. And we need to come up with a plan regarding protective gear to protect healthcare professionals, as well as making sure we have enough ICU beds, in town, and respirators and ventilators, and we need to come up with a plan for that.
Would you be able to be the liaison, for instance, at Medical Associates? The Surgeon General has recommended on Saturday that elective surgeries be postponed.
Exactly.
Is that something that you see your role as being to help execute?
Yes.
I don't know if that's a proclamation or what the word is.
Yes,
but-
because one problem we have now is we have multiple healthcare systems within Dubuque and private groups who are kind of acting independently. And again, from a Board of Health and Board of Supervisors perspective, we need a unified voice giving recommendations.
As part of discussion, I would ask
And we got a big
my
agenda if you can.
go-to team, do you have questions that you would like to ask before I vote on this?
Well, right before when he had walked in, I did ask about the physicians from the other medical associates and Mercy, because I think since we're working with all of the healthcare providers, I think we should have a good collaboration
I agree.
with those agencies
I
as well.
completely
So,
agree, yeah.
Do you feel this would be helpful then, Patrice?
Yes, I do. And I've worked with Dr. Viner in the past for the H1N1, and it was very beneficial. As long as Dr. Powers will, because she's on the board of health as well, be involved, so. if she
Absolutely.
chooses.
Absolutely, and she would be a great reference.
She will.
Okay, let's call the vote. We have a big group, a lot of big agenda. I think we've reached. Let's move forward with the vote, please, Chair.
Yeah. I just want one other comment. We're blessed to have long-term experienced leadership, and this is a time that we need it with Patrice Lambert and Tom Berger in the positions they're in. So, I think I'm ready to move forward.
think we have a
So
motion
all
and a
in favor of the motion signify by saying aye.
Aye.
Aye. Carried 3-0. Okay.
Thank you, Dr.
Thank you,
Canal.
Doctor.
Appreciate it.
Okay, and again, I'm gonna vary from the agenda. This is regarding the COVID-19 issue. Late last night, Matter of fact, I don't even know that it made the 10 o'clock news. It was sometime after that where they announced that schools are going to be closed. I think it's for at least 4 weeks. And I think that's, I'm not aware of any district in the state that is not closing for 4 weeks. So one of the issues that had come up over the weekend while I was in my exile, or whatever you want to call it, self-quarantine, was I was getting calls about childcare. So I contacted a few folks that I know, Jake Rios, for example, and Jake assured me he would help get word out, and others. I made some phone calls, and appreciate everybody's effort. So I think want to hear about concerns about the effects that this is going to have on childcare providers and on the students, the parents, and what, as a county, what we can do to help with this. My understanding, and I had a conversation earlier today, and that, it sounds like the federal government has good intentions. I would like to think that Dubuque County at this level, at the local level, that we're a little more nimble, and we can act a little quicker than at the federal level. And so we may have to fill in some gaps until the Fed machine gets rolling. For example, if it takes, and I just use FEMA for an example in flood events, it takes a long time to get people help. When we're talking about actual dollars and cents, it can take years. Well, I think in this case, a month, 2 weeks, a week is too long. People depend on their child care providers.
Who do we have here today? Do you know? We have.
Yeah, why don't we do this?
This is good point for discussion,
Yeah.
but I think some discussion might be beneficial. First of all, we don't have this in any way listed on our agenda. This is about emergency response, and this is about county operations response plan. So, we obviously, if you want to take comment from people, I think, I guess we'll need to decide if we're going to do that. But I don't think we can take action today. It's not, again, the room is with people that we have reached out to. It's not open to the public.
Thank you for that civics lesson, Ann. I wasn't planning on taking any action today.
And that's why we're in
And
discussion,
we
Dave.
are,
To be
I'd
sure
like
that we know
we're
what
fi-
we're
Hear
doing.
from the child care
we're
providers and
fine
move
to
forward.
have discussion on any topic, and I agree with you. Any action that we would take, I don't even know what action we might take.
Right.
I want to hear from the providers. So going forward, I'm gonna ask that the child care providers, and we can start up here. I'll start with Jake, and we'll go around the room and just say your name, and if you're representing an organization, or if you're a at-home provider, let us know that, so we know who's in the room. So,
Maybe you can stand up and give your name loudly and clearly. I will not be able to hear you if you don't shout.
All right, I guess I'll start. I'm Jake Rios. My wife and I used to run infant daycare, so I've been in contact with those people, and then we also run Little Leagues Learning Academy, which is on Locust, and then a new one opening up eventually in Key West.
Thank you.
My name is Barb Weber, and I'm the co-director and owner of Youngins Preschool and Child Care Center in Dubuque.
why don't we go back if there's any other child care
I'm
providers?
Sue Ellen Nolan, I'm the director at Key West Early Childhood Center. I'm Melissa Donovan, I'm the owner and the executive director at ABC Learning Early Childhood Center in Pittsburgh.
Ann Ludwig, I am one of the co-directors at the NICC Child Development Center in Seattle campus.
I'm Shelley Rowling, I am the other co-director at NICC.
Liz Ernst, I'm the director at Resurrection Early Childhood. Tina Potoff, the director at St. Anthony's and Our Lady of Guadalupe. Anita Valentine, director of Holy Ghost Early Childhood.
Joanne O'Connell, Director at St. Joe's Worker Early Childhood, and the Coordinator for Holy Family Early Childhood.
Brianna Cryer, representing Rockford Conference Child Care Center. Beaver, the Supervisor of the Numbers. Angela Schrodt, I'm the Director of the Marine and Tyson Child Care Center at Campus Square.
Jason Rath is no italics for the women's and the rest of the treasure state cares. These are our directors.
Did you say Little Rascals?
Little Rascals and no treasure.
On Hillcrest.
On, no, Radford and
I heard
Rockdale.
Little Rascals and that's all I heard, I'm sorry.
Oh,
Sorry.
Can you try to, do you have these people?
it's both Rascals and Treasures.
Right, one of them I know is on Radford Road and the other on Rockdale Road. Okay,
Is anyone else?
Keith Alvin representing the Dubuque Y.
Judy Wolf, also from Marita Tyson Child Care Center. I'm the President of the Board of Directors.
okay, thank you.
Have someone-
Oh, I'm sorry.
Deb McDonald from here.
Okay, well, thank you all for being here. Again, the rules are changing, daily, almost hourly, and, it's true that we may not, we cannot today, come up with any final solutions, but we have to get the discussion started. So I think we wanna hear, concerns that you have, barriers. This is a big change for everyone. So we want to hear your concerns, and then we'll figure out how we can help, and maybe have a meeting, follow-up meeting that hopefully we can help address some issues. So does somebody want to start?
Give him at the podium too.
Okay. Yeah, we'll need you to go to the podium and give your name and who you're with because of the miking system. So if somebody wants to start.
Hi, can you hear me?
Yeah.
Okay, so some of our concerns at Youngins are just we want to be able to pay our staff if we end up closing. I guess we want direction as to what is socially responsible. If the schools are closing, does it really make sense for us to gather over hundreds of children into our centers, into spaces? Does it make sense to have parents, hundreds of parents walking in and out of our doors? Are we allowed to charge our families? Does that depend on what our contracts say? You know, and at least maintain some sort of income? Are we able to have our employees file for unemployment? Is there a different source of income to pay our full-time staff, our part-time staff? Those are many of our top concerns, besides keeping our children safe. I mean, those basic things came rushing. That protocol is obviously in place.
Did you want to have some dialogue, or do you want to hear from a few others, and then we'll start some dialogue?
Yeah, why don't we, I'm starting a list, I'm sure you are as well. Why don't we hear, of the concerns, and then we'll try to have a discussion. Thank you, Deb. We're done. So.
I guess in light of the three questions, I've kind of got three sections of things you're talking about. So I would appreciate anybody else coming forward saying, you know, you're here before the County Board of Supervisors and we want to listen, but who have you talked to? You know, I own a small company. We are doing the same kind of, with 90% of our businesses with schools, teams, clubs, so forth. So everyone is running through the scenario you just ran through. That was morning coffee discussion yesterday, today. So who have you spoken to? Are you here because you have something specific you think we can help with? So that will help kind of let us know what's being formulated as what action would you want us to take? Is it just information? Are we the information, provider?
Maybe direction on what's socially acceptable, socially responsible.
And I'd like to get to that. Jake, if you have comment, go up here. I'd like to hear some comments quick, and I've got plenty of ideas, but I want to hear from you first.
Okay, because I'm kind of.
Well, we need you at the podium for.
Yep, so.
Yeah, just questions, comments, in a 2 or 3 minute forum, I think will help, and we'll keep moving.
So, a couple of things, I reached out to the in-home providers, and one of their concerns was.
What that is, NIMO providers.
In-home, sorry.
Okay.
And could you introduce yourself again, Jake, for the record?
Jake Rios, do I need to give my address, or?
Address, please.
I live at 561 Jefferson Street,
Thank you.
here in Dubuque. So sorry about that. Okay, there. So, in-home providers, reached out to me because I reached out to them in regards to what they're gonna go through. In particular, they buy supplies from, the same places that we all do personally. So they have to go to supermarkets to get toilet paper. One of the ladies said that she had to buy an 8-pack of toilet paper, that's all they had. She had to wipe $10. So that's a concern for the in-home providers. They're also gonna suffer possibly from any kind of food that they would normally give to their kids that's healthy, that we normally have access to, because my wife and I did it, so we know where we get those resources. What I proposed to some of the in-home providers was that I know for sure that we would be open to using our distributor, because distributors are not going to be affected as much as, say, Walmart and places like that. They can afford people. So we could be a point to where they could come in and help get products for them, such as paper products and food and all that kind of stuff. And our distributor has said that they have plenty of paper products, not to give away their secret, but we are still able to do that. Another concern is that especially with downtown, that some of our parents are going to be at a loss, especially for things like dinner time meals and whatnot. So the concern about the health kind of conflicts with what we're trying to do in providing meals to kids when I know the schools have thought about providing meals too, so that how are we going to do that and whatnot. I came up with 4 scenarios for our daycare center. Oh, and to address some of the things about insurance, I heard back from our insurance agent, 3 things have to happen with our insurance. I think the first one was that we have to be insured. That goes without saying. The second thing is that someone has to have the virus in the facility. And the third thing is that the state or local government would have to shut down the center. Now that works if it goes in that order. So if someone has the virus, we can easily call someone from the city or the county or the state and say, someone has the virus, can you shut us down? The bad thing is our insurance policy only covers $50,000. For us, that only covers a month.
What kind of insurance are you speaking about? Business interruption, general liability,
This is if we have any kind of epidemic, whether it's it's a special part of the policy. It's our business insurance.
Policy?
Do you want to tell you who it's through?
I'm wondering what's the nature of the policy? Is it just a
It
general
covers the
business
business. It
insurance
covers the
policy?
business and it covers incidents such as this.
Okay, so it's just a general business owner's policy?
Pretty much, yeah. It's kind of like your blanket insurance that you can get for just about anything. So they would somewhat cover that, but if it happens the other way, if daycares are canceled, then and no one has the virus in your facility, in terms of our daycare, I'm sure other ones are like this too, then they won't cover you for that loss. So I have reached out to our insurance to check on that, and so we're kind of up a creek in that instance, but we can be shut down by the Iowa DHS. If we choose to stay open and go against their judgment, we would get fined $1,000 a day. So we have to get DHS involved in this too.
Have they given you any guidance at this point?
Not at all, not that I've seen.
Have you reached out to them?
Have they?
Yeah.
So we do have some guidance?
Okay,
Yeah.
so maybe somebody can stand in line here or get up there and speak to that after Jake's done, it'd be great.
So, and it goes in a couple of different ways. Either nothing will happen and it'll kind of calm itself out. We may have numbers that are similar to the summertime. We could see a sudden drop. In terms of employees, we have salaried employees, so they get paid no matter what. But the bottom line is, if our business isn't viable when they come back and we don't have a business, then we've done worse than what we were trying to solve, I guess, in that case. So we have looked at different scenarios. I came up with 4 scenarios myself, and that's one of them is that we'd have to change people to hourly and get rid of salaried employees and then hope for the best. But the Family Medical Leave Act only covers if you have the one that's being proposed in Congress. It's only if you have someone, if you're sick yourself, you're taking care of someone sick, and one of the parts is that if you're inconvenienced by care, I believe it was the other part. And so in terms of our employees, they wouldn't technically get that 2 weeks of FMLA that we would still have to pay them. And then on the other end, that would kind of destroy what we'll be making zero money. And for those who are basically cash paying, if their kids aren't there, I'm assuming that they don't get the money. So that's the downside of that, I'm assuming. We're mostly state-paid kids, we're 85% state-paid kids. So I'm not sure how the state's gonna be involved in that either, so.
One thing I would point, Liz Mathis, on Facebook, she might be someone you want to follow, she was giving advice about SBA loans, that she was listening to constituents call in, all small businesses are going through this. You are unique because you are an enterprise that deals directly with something we know is already a missing service and a much and desperately needed service. But she was on Facebook sharing plans of what, we're all scrambling, but some people are out ahead of us looking for solutions as well. So there's just another thing to look at, the Small Business Administration. You have someone here who would know that well.
Yeah, I'm funded by them, so I'm familiar with that program. We can address that as needed. It's probably not going to be our lifesaver this week, but they are moving forward.
And to one more thing, in terms of how we keep the spread down, we've actually stopped allowing parents to actually check in because every place is going to be secured in town. You have to usually use a touch-in code or a computer. We stopped allowing the parents to do that. They come in bringing their kids, and then we take their kids to the rooms just to keep down the spread of every parent touching every ankle. So it is adapting some of what our practices are. If so be it, that goes against DHS rules. Hand sanitizer we're not allowed to have in their classrooms. So that shorthands us there. But it says nothing of rooms that are commonplace like an entryway. We have an entryway where people come in. So to some extent, if that gets us in trouble, then it's better to be healthy in that case, taking the precautions than to get a ding on the report. So.
Thank you, Jake.
Okay. Thanks.
I'd like to hear from somebody who mentioned that they had contact with the DHS. Did anyone have any information related to DHS? Maybe that's what I assume, but if not, anyone.
I can email it over.
Get the lights there. Chair, just get an opportunity to the podium or let's have a discussion.
Do we have somebody else that wants to come up and talk? I thought I heard somebody say that they were. Oh, I do. All right.
I'm not speaking so much on behalf of operations, but just overall. We have had communication from DHS. At this point, they're advising, I think requiring almost what Jake mentioned, with child care centers meeting parents, care providers at the door and taking children to the classroom, avoiding unnecessary access. We're also doing extra cleaning at our center, and I'm sure others are. But I think the thing that I saw in the DHS note, I saw most recently, that resonated the most was the need to talk about it. Maybe we can do this with some kind of coalition of child care providers and, the government maybe, talk about how we can keep the centers open, because the issue is with schools closing, there's more of a need for child care, and people don't have a place to take their kids. It means that our whole business structure is going to shut down. And I guess at the big picture level, that concerns me. Certainly I'm concerned for the safety of the children, but I'm also concerned that we're doing everything we can as a child care community to assure that we can care for as many kids as we can, so that we can keep the community going. And that's all I'm going to say.
I appreciate those comments, and I'll jump in. I think you're right on the head. So we need the child care centers to stay open for critical functions. Okay, so those critical functions are obviously people that are in healthcare, those in law enforcement, those in critical transportation, those are in critical utilities. Those people keep the lights on, the water, the sewer, keep us protected, and they hopefully keep us healthy. So we absolutely need to be sure that they have reliable daycare and reliable child care so that they can do their job. Non-essential employees across the country and across Dubuque County will be furloughed, sent home. That's where we're going. And so they'll be home with their kids. And so we do need child care to eventually probably start to prioritize those areas. Obviously, if we have an outbreak at a center, then you're going to close. And you'll be done. And so do your best to prevent that. But we need you as a critical function to take care of children of those that are in critical roles.
Judy, did everyone come to your center today?
Can I,
Sure.
let Angela, let you know that? I can.
And I'm curious if there is a Dubuque County Child Care Coalition or a go-to person or agency of some kind. Oh, sorry.
Okay, my name is Angela Schroed. I'm the director at Marita Tyson Child Care Center at Steeple Square. Kind of speaking to a couple different things. First, no offense to anyone here, but I think this would be a lot more conducive if child care resource referral or a rep from DHS were at the table to kind of help us talk through this a little bit, because those are the people that are providing us the communication that we're getting. So we have been getting as providers email updates. Last one we just got was on Saturday, and it did recommend that we should not preemptively close our centers. And it gave the new guidelines for entering the building, and then it explained further guidelines on what to do if you have had an outbreak in the building. There's not been any direction from DHS at this point to close centers. As far as attendance, our attendance today is really down. We have a lot of students who are gone because moms and dads are on spring break, older brothers and sisters are on spring break. We have people that are, quite frankly, just getting nervous and keeping their kids at home. So I hear you saying that we need to stay open, and I would agree that there are many people that will continue to need childcare, but the issue then from a business standpoint comes from those people who are choosing to keep their children home. Like they were saying from youngins, do we build those families? My husband is a non-essential employee. He works at Cottingham and Butler, and so if they send him home and he starts working from home, he can keep my daughter at home with him. Do I still have to pay for childcare? Well, part of me says, no, I shouldn't have to, but realistically, for the center to pay the bills, somebody has to pay for that. The parents, we all rely on our parents' weekly tuition from every single family to pay for that. So I think that when we start saying, what can the county do for us, it is going to have to be financial assistance from the state, from somewhere, in order to help keep this going, especially if we start saying, you can't bring your child because you're not essential, but you are essential, so you can bring your child. If we start limiting that, that money has to come from somewhere to keep all of our employees in the job.
Angela, you're absolutely right. So this board, just over the last year, has funded about $475,000 in child care. So we're already spending money in child care, and whether it's the local, state, or federal level, there will be funding available for critical services. And my opinion, and it's not done, we're just working through this, child care for those that are in those sections that I mentioned that we depend upon in healthcare and so on and so forth, as I said, need those spaces. And so if financial consideration and or compensation needs to be made to keep you open, I will be an advocate for that, and I will be trying to construct that. Don't have any answers for you today, but this board, through many efforts over the last couple of years, has spent already roughly $500,000 allocated. Some of that was just in this year. And so we are with you and prepared to bring the taxpayers' money and budget to help solve critical issues.
Thank you. I'm going to comment on the critical essential employees, and I agree with the folks that you mentioned, the occupations that you mentioned. But what about our food providers? What about our truck drivers and delivery people who we depend on now because nobody has inventory anymore? Everything's just in time. So if you take the UPSs and the FedExes and the delivery, if they're not considered critical,
It's a critical transition. I'm with you. So I'm with you. I'll go you mentioned.
I think it goes further than that. How many in here would think of the people who work at the landfill as critical?
Well, maybe in essence, to not get too deep in the weeds, I think if we agree that we can offer support, I think then to get the group out in a separate task force to start working on things would be good. This dialogue in this forum is not good at solving problems. It's good to understand what problems are, make sure you know that we at least agree or hearing you and can offer some solutions. But we're going to need leadership from those areas that you're specifically in, your domain. And that probably won't be resolved here. So I'm open to dialogue, but I would not try to solve this issue in this forum.
I don't think we're going to solve anything today. I just didn't want people thinking that only doctors, nurses, cops and firefighters are the only essential, critical employees. I think daycare staff are critical and essential in this case.
So one of the things that I mentioned before when we were having childcare discussions, and some of you were at a forum where I was and attended recently some education, we were all at brainstorming issues, was that who's the central point? This again shows a weakness of who's the central point. We have a critical essential service, and we don't have anyone who's bringing you all together. We don't have anyone who's looking at what are your strengths, what are your weaknesses, how do we solve when kids are low, how do we take the hand sanitizer. There's no central coordination of this. And somebody who's missing from this room who has indicated, a couple of folks are missing that have indicated they're that. Greater Dubuque Development Corporation's not here. I don't know if anybody's here from Dubuque County Early Childhood. They're not here. So there's some folks who, I think that the pooling together of you all is critical. Probably not when we are 40 people packed into this room, because we're all trying to not get the virus as well. And so just know that I don't know that this is the most productive. You have sympathetic ear here, but you need to come with what we can best do to bring to bear to make it to work for everybody. That may not happen unless you come to some other solutions outside this room. Patrice has indicated she has been working on this issue as well, and she's the charge in our Board of Health.
Please, Patrice. Just while Patrice is going to the podium, this started, so there were no gold-plated invitations sent out. This started as a discussion yesterday afternoon on Messenger between Jake Rios and myself. And I think word got out, but this was not intended to be the end all, and it was intended to be the start of an important discussion.
Good start.
Okay, and I'm Patrice Lambert with the Dubuque County Health Department. And first of all, I have to say, I really appreciate the faces that are here because I know you all by email. I just don't know you by face, so that helps immensely. But just two real quick things. We do have a group that meets on a daily basis, Tom Berger, Stacy, Killian, Mary Rose, and myself. And at our meeting today, daycare was one of our top priorities. And what I have to report to the Board of Supervisors is that we were looking at possibly a plan by having Kim Gonzalez, does everybody know her from the VNA? Because she knows all of you. Being the steer person or the main person to meet with the daycare providers, and then any requests or any concerns or whatever would go through here to go to the Board of Supervisors instead of asking everyone, to come to a Board of Supervisors meeting or whatever the case may be. So that is part of the proposal for my report to the Board of Supervisors when I'm on the agenda soon. So we were just thinking of having the one key person. Kim knows all of you. We thought she would be the primary person. So if that does get passed through the Board of Supervisors, would that be a good plan? She would contact you all, arrange meetings, take your concerns, and then bring them back to us. We would try and do as much legwork as possible and bring the concerns back to the Board of Supervisors.
I see a lot of nodding heads.
Yeah, that's good.
Okay,
Good.
great.
You hit the nail on the head.
The second item is, again, I know you know this, but I'm just going to remind you because things do change rapidly, but there are some talking points, and Tom, I think you just made copies of them, didn't you? From the Iowa Department of Public Health. If you just go to the child care centers and homes, it does address a lot of those, but I know you already have it. If you go to the Iowa Department of Public Health COVID-19 page, it's actually under businesses. But I only mention this because if there's anything that they change it at that website. So I don't even know what the date is on the one that Tom's giving you, but just do check that daily, because if there's anything as far as recommendations from IDPH or the CDC, it would be listed on that site. So, okay?
Great job,
and you
Patrice.
are a vital key to all of this. So thank you very much.
Thanks, Patrice. Yeah, I think that's a great step forward.
It's good.
Anybody else?
We got extra copies
other
here if anyone would
issues?
like to see a printout.
Any other comments? Yeah.
Oh.
Anybody else for comments? Thank you all for being here. I think, establishing Kim as, head, of a steering committee, you'll have someone to talk to. Patrice, do you have the logistics worked out about how to get this out? Maybe,
Kim will do that.
Stay tuned, okay. Stay tuned. I have a necessity break, so I will make a motion to recess for 5 minutes, and then the child care providers can exit if we're done with this.
I just want to make sure that if they have any other questions before we do that.
I'd love that.
I'll make a motion to recess for 5 minutes.
Second.
All in favor?
Aye.
Aye.
I need.
Reconvene the Board of Supervisors meeting Monday, March 16th. It's 1:58 PM after a brief recess. So we'll go to the top of the agenda. I know we've touched on some of this already, but update from the County Emergency Response Team on COVID-19. Patrice, Tom?
Okay, just a few updates to share with you. As you did receive my emails over the week, things change constantly. So I just wanted to share the most recent numbers in the state of Iowa. This is when I walked out of the office this morning at 10 o'clock, and I believe it was the updated. We have, for the state of Iowa, we have 156 people who are currently being monitored. We have 47 people who have completed their monitoring. As far as reported cases in Iowa, we have 2 in Alameda, 1 in Carroll, 1 in Dallas, 1 in Harrison, 15 in Johnson, 1 in Polk, 1 in Potawatomi. So we now have a total of 22 individuals. We do have, as far as tests, we do have 313 people in that. Oh, I'm sorry. I'm going on to Wisconsin. With the state of Iowa, as far as the testing now, we are not going to know how many tests are pending. So they're only going to report out on the tests that have been completed as positive. So I will not be able to share any information that 28 people in our county have been tested. That is not going to be done. Just the positives are.
Who decided that?
Well, it has testing is being offered at many different laboratories. Therefore, the number of tests pending and negative is no longer available. As of today, IDPH will be focusing on reporting positive results, which are required by law to be reported to the department. So it's the Iowa Department of Public Health that made that decision, and they just made it today. So then I did look at Wisconsin.
Patrice, do we know why?
Yes, because they're now allowing other laboratories to do the testing. The labs, the physicians now don't have to get the approval from IDPH to run that.
Probably don't have the number, an accurate number.
Yeah, so the
I don't
labs
know.
can.
That's my guess.
Yeah, so the labs can, there's 2 major labs in the state of Iowa that do contract with hospitals, and they can do those tests, but they're only required to notify IDPH if they're positive, not negative. So that's how they can't keep track of the testing now for the negatives. And that was as of today. And then in Wisconsin, I just pulled off their information when I walked out of the office. They're still doing negative positive. They had 313 people tested and that were negative, and they are now at 32 who are positive. So Wisconsin, they then, let's see here, have, and I'm just trying to look at the counties here. I don't know which ones are close or not, but Dane has 6, Fond du Lac 11, Milwaukee 7, Pierce 1, Racine 1, Sheboygan 3, Waukesha 3, Winnebago, and that's 1, and that's their 33. And then I looked at Illinois, and Illinois, as of today, or when I printed this off, they had 93 positive. They had 932 negative, with a total that they have tested, I believe it comes out to be 1,025. And they did not do a breakdown for their counties, so I couldn't look at any adjoining counties that might be across the bridge. And then, okay, so just some updates to share with you. As I had said earlier, Tom and Stacy Killian from the VNA, Mary Rose and I are meeting on a daily basis, and we probably saw each other more than what we wanted to over the weekend, but that's okay. We are having our larger steering committee meet once a week still, and that would be a representative from Mercy as well as a representative from Finley. We are looking at still holding our Dubuque County Healthcare Preparedness Coalition meeting on Thursday. We're going to do that per Zoom because we're really promoting the social distancing. We have approximately 125 people in that coalition, and Tom has already worked with Nathan to get our Zoom set up. Let's see here. The VNA, such as today with our discussion, we are looking at Kim being the liaison to the daycare providers. Well, we're also looking at having our calling center just go to the VNA. Because Dave, you had mentioned when you called the 211, you had to wait for 30 minutes and then you didn't even get your answer or your question answered. We know that I had someone in my office this morning that tried to call Lynn County Public Health and they weren't even accepting calls. They were going to the 211. So we just don't want people in Dubuque County to get frustrated by not having their question answered. So we are proposing that we have one call center and that go to the VNA. Stacy actually has 6 RNs that can rotate that position. She said that she would have data even on a daily basis if you would like that to have the calls that are coming in on a daily basis. Right now, if we do get this approved, but right now they're coming to Tom, they're coming to Mary Rose, they're coming to Stacy, they're coming to me. We would just like to have one consistent location, get that information out, and then people don't have to go to the 211 and wait for the half an hour or whatever the case may be. We're also looking at increasing staff time for education, such as with Kim working with the daycare. And if we look at everything that we're proposing, Stacy really felt that it might be an increase of up to 75 hours per week. And then we're also looking at supplies and masks and shields if they become available to purchase, and then the hand sanitizer, and then thermometers. And we do need those thermometers if we were to get any quarantine issues. So Stacy broke down, if we did go this track for 4 weeks, she would need an additional approximately $15,000. Then we went 8 weeks and it would just be the $30,000. And then we thought, well, what happens if we go until the end of this fiscal year? The last day of June, which would be 12 weeks basically, that would be an additional $45,000. So we're just proposing this to you, and we'll set everything in action if you want us to proceed. But they were issues such as Kim coordinating the healthcare providers. Let's see here.
Trace, can I ask, if we do this, and I think it sounds like a great idea, but would they provide, answering the phone, but would they also disseminate the information on at least a daily basis, maybe the way things are moving a couple times a day, an AM and a PM update, that type of thing? Would that be part of this?
They would be more than willing to do whatever is requested, but yes.
I assume the media would then grab onto it. It's,
We do. Wait. Yeah. Do you want to explain that, Tom? I mean, I can, but you can.
Okay, what we're doing also is, the information is changing so much that we're working on pulling together some people that are trained in public information, PIOs, Randy Gale from the city, Mike Sides from the school, Dubuque Community Schools and other ones that we can get in to kind of help. Be one central hub for the information that can get the information out to the VNA for people that call in. So when you call and get your question asked, they'll know the answer, as well as circulating that to the media. They'd also be a hub for the media to get that information out, because by the time you, with this event, by the time you print something, it's outdated by the time you get it out, it seems like. So that's where that Joint Information Center will help kind of coordinate what everybody's saying.
Right. And we don't want the media to get frustrated. For example, on Friday, one of the TH reporters had called. I didn't get back to the office until 8, so I returned the call. And she, you know, I was apologetic, but she had said, no, I went to this person, and this person. So it would just be nice to have, you know, one central person. So even the media doesn't have to try and contact, you know, various people to get the information that they need. So that's in the planning as well.
Is that how Terry Goodman comes into this also?
No, Terry Goodman, we were looking at a structure with, I don't know if you were included with some of the emails that from our legislators. They were just asking, could they have our PowerPoint that we presented last week, which I did send. I mean, they've been asking various questions, but once we found that maybe I had responded or Tom had responded, we thought, you know, that's really valuable time. You know, if one person's doing it, another person's doing it, and then if we even designated someone, that's still time out of our schedule. So Terry apparently is, Tom, you probably know this better than I, the
She's kind of acting as a liaison to the elected officials, is basically what it is. So they're familiar with Terry, they work with her all the time, she's familiar, knows how to get a hold of them, so it kind of takes the burden off us to work the event rather than, you know, have to go back on that, so.
I think it's a great idea.
Yeah.
I will have a question for her, that if she's also, you know, she obviously knows state legislators, but we're gonna have potentially cities, small cities and towns that are gonna have questions, and fire EMS, so.
And I will be honest, Ann, with all of our discussion, I said we have to include Cascade, Sherrill,
Correct.
Sageville. I mean, for everything, daycare, everything, because we are here for the residents of the county, so, yeah. And then we also are looking at Kelly Larson, because when we do have some questions coming in right now, but also if we designate VNA as a calling center, we have different we do have some still language barriers. So Kelly is going to help us just to increase the list of people that we can contact that can translate for us if we need it. So that's all up in the planning as well. And then, what was the other item, Tom, with the JIG? Well, I'll keep going. If I think of it, I'll come back to that, so. We also, for an update, the Community Foundation has activated their Dubuque Disaster Relief Fund, and they'll be looking for seed funding, focusing on the disproportionate affected in the community. And then the Co-ed Long-Term Recovery Committee will meet directly with this fund, and the two people are Tom and Stacy Killian from our steering committee. Do you want to add anything else on that one, Tom?
Yeah, that's similar to what we do, activated in any big disasters where they'll raise money, get a fund together, and then the Long-Term Recovery Committee, after all other resources are exhausted, people can apply to the Long-Term Recovery Committee to this donated money and go through the casework and be.
And that's being headed by the Dubuque Community Foundation?
The Community Foundation
of Greater
sets up the fund, and then they try to get the money in there, and then they'll dole it out.
Wonderful. Good.
So,
And then Tom and Stacy
kind of the
will
unmet needs type of thing.
will be our contact for that. Then just a couple more things, I'm sorry. With the mitigation guidance, IDPH did issue their talking points or their recommendations for that. And the last that we had gotten was at 3/14 at 8:30 p.m. So that was what, Saturday evening? And their recommendation was looking at canceling large gatherings with 250 people. But however, CDC is changing that as well as we speak. So we were notified of another press conference that will be on tonight at, what time, 4:30, Tom? With the governor. So we're hoping that IDPH and the CDC have come up with some new mitigation guidelines for us. So I'm not even going to share all because CDC has already made changes from Saturday night at 8:30 with the IDPHs. Just a couple more things. Okay, schools, I tried to get that out as quickly as possible, the recommendation to you, the Board of Health, and to the superintendents last evening. And I'll be honest, we had 2 webinars Saturday and 2 on Sunday. And the message through that was basically that they did not want to disrupt school unless they had to. And at that time, the recommendation was 2 to 4 days at the most. But because one of our testing did come out in a younger population, they went ahead and decided to cancel. So that was the first that we knew when I shot that email out to you last night. Otherwise, if we would have known something that major, trust me, I'll get it out to you, I'll get it out to the Board of Health, and then those appropriate people as well. So it was kind of a rapid thing last night. And Tom, I think that's pretty much what I have, unless you have anything to add. Okay.
Can you do the
Chair, yeah. Joe, can we, yeah, thank you.
This would be for Patrice or Tom. Just for our deputies who are out on the street, in the event that they would come across somebody who's, say, intravenous drug user and get stuck by a needle, are they still saying that the most prominent way to transmit this is through the exchange of spit? And has there been any known transmissions as a result of intravenous needle sticks?
It's a good question.
They still believe that, or they're still saying that the COVID-19 is transmitted through airborne. So that's, I mean, that would be your spit going out. Social distancing, they're saying 6 feet because people's airborne droplets could travel that far. And I forgot the other part of your question you just had asked.
Are they?
Oh, I know. No, I know what you were saying. But now, because the state of Iowa has just identified 2 community spread cases, which they've had no travel whatsoever, they've had no linkage with someone who has been diagnosed. So what they're saying now is because someone, basically 2 people in the state of Iowa now probably were exposed, not even knowing that someone else's droplet who had the virus itself went ahead and landed on another person, and that's how that transmission occurred. So they're still saying airborne for this. Yeah, droplet.
I have a follow-up question then that, for our first responders, law enforcement. If they get a needle stick, should they be tested for the COVID virus?
No, right now, it's my understanding that COVID is airborne. So that would not be through the blood, but hepatitis A, B, C, E, everything else.
That doesn't seem to make sense to me, but could we follow up and ask that specific question when you're on your next conference call?
Oh, do you want to speak? I'm sorry.
All the first responders and EMS services have to have an exposure control policy, which would tie them into their workers' comp insurance and providers. So if they use Tri-State Occupational Health or Finley Occupational Health, then they would have to go there and start an immediate blood draw for things a lot worse than this.
Okay.
So there's policies in place that you have to have as an EMS service.
So is COVID-19 a concern for our first responders?
Well, it's a concern, but it's not on a needle stick, more so with somebody coughing and spitting on you.
Okay.
Okay, the only other thing I had to add, or have to add, is as far as the Emergency Operations Center, we're working slowly to get that up and ready to go. As far as the contact with the smaller communities, I've been contacted by 3 of them. I did send an email out to all the clerks, and we'll plan on having, once we get some more information on the federal disaster declaration, what that exactly means for municipalities. It is a Stafford Act declaration, so that's the same one we use for floods and natural disasters. So what I'm telling everybody now, till I get further guidance, because we never worked with it this way before, it's usually we're swamped, we're invoking mutual aid, and then we ask for the federal government to help. The federal government is offering to help now through the Stafford Act, so I'm just telling them, until we get more information, they need to track their expenses, track their time. Any volunteer hours will help towards the local share if it's similar to presidential declaration for like a flood. So I'm hoping more information comes out, and then we're going to set up a conference call talking with all the small communities and local jurisdictions. So.
Okay. Thank you.
Last thing, are you finished, Tom? Okay, just one last thing. You might have seen different places such as Madison. They're looking at experimenting with their assessment and testing for people with upper respiratory infections. They're looking at getting an empty parking lot and having a drive-through type of thing. A lot of communities are looking at what can we do to prevent someone who has an upper respiratory illness, even going into an acute care center, sitting next to an elderly person who might only be there for an ingrown toenail or whatever the case may be, but we know that that is one of our vulnerable designated risk population. So we're looking at how can we remove the respiratory distressed people into one central location. So right now, as we're here, Stacy, Killian, and Mary Rose are meeting with the various medical centers just to start brainstorming. Is there another solution that we can come up to have one neutral site? So that's in action as well right now.
Well, I have
Good idea.
Patrice and Tom at the podium. I want to ask a question, and I'm guessing that you all have friends and family members. What is the comparison? Why is there a comparison between the flu and the COVID-19 virus? And why do people think because there's more flu that this thing isn't serious? And is there a comparison? And why should we be so concerned about COVID-19 when we have more flu cases? I'm tired of reading about people talking about the flu, and they're saying it kind of making it sound like there's more people with the flu, so COVID-19 can't be that bad.
Okay, I can share with you, influenza has been around for a long, long time. So we've actually had experts that are able to look at the strain within influenza and develop a vaccine that whatever is at in the Asian country 6 months before us, we know that that influenza strain will be coming to us 6 months later, so we're able to get a vaccination already to do one of the preventive steps from people getting the influenza. With the COVID-19, this is brand new. We don't know that much. We don't know if there's different strains as of yet. I know that the experts are working on a vaccine right now, but it's still going to probably be another year. Basically, what they do know is because there's 7 different types of COVID viruses out there, but this is the first time that we're actually seeing the COVID-19. We do know that this virus likes to latch on to the lungs, and that's why it goes directly after the respiratory system. But because it's brand new, we don't know, will we be able to build up immunity if we're exposed to it? Like influenza and everything else out there, at least if we're exposed, our body has the right sense to build up an immunity. So in some of our situations with our illnesses, if we do come with that virus again into our system, we possibly won't get as ill because our body has looked at whatever was introduced into our body as that virus, and they're able to start that immunity to guard themselves if they have to have it come into their body again. Whereas COVID, this is brand new. We have no clue. We have no idea if we get exposed once, can we get exposed twice, can we get exposed 3 times? We don't know if there's strains that we can actually look at that and have that a different vaccine for COVID every year. So it's all because it's brand new. It's just being introduced to the human population.
Okay.
Does that help?
Yes, thank you.
Chair, I know we have budget on here now, but would the board like to speak specifically related to new budget allocations for EMS and for the Board of Health?
I think that's on here under our.
Would you want to address that now? So, I mean, what my question is, and what I would like to do, the direction I'd like to do is to signal to the budget director to modify the budget for Department of Health and EMS for appropriate levels. And I'm thinking in the hundreds of thousands of dollars to give you the discretion to do what you need to do with your community leaders, the board, and the team you're assembling. And so that would be my question back to the Board of Supervisors, and then to you two if that's appropriate.
So that would be, if we were to look at the VNA, because with the health department, I'm working side by side with Stacy and her staff. So that would be that I could allocate different funding.
We would, my direction would be that we would, I propose $500,000 to go into the health department for this year's budget. That would be a budget amendment, and those funds would be available between now and June 30th. And so you would have the funds available to execute a plan and, God forbid, more of a outbreak plan. That's probably where it reached that level. So that's where I would be liking for you, and then we'll talk with EMS as well. At this stage, I don't believe it's going to be helpful if you come back to the Board of Supervisors for every $15,000 ask, okay? We need to move quicker, and we need to respond in a more bigger way, and that might take additional resources. So that's what I would like the board to do, is to modify the health department budget. I'm proposing $500,000 as a placeholder to be able to execute those funds between now and June 30th, and then we'll deal with fiscal year 21 when allowed.
Would those funds include the physician we just
Yes,
entered
absolutely.
into today? And
Yes.
then also, if you need other personnel to help with phone answering, I know at your own department, there's some concern about whether you're being overwhelmed there just with routine things. I would like to know a little more flesh out about what other needs you might need and Tom, you are at a department of 1. So looking at, I wouldn't want it to just be supplies if the top need you need is somebody to help carry the load of administrative things that you're doing.
Agreed.
Yeah, I'd propose everything you need. So, it's going to be pretty hard to get health professionals right now. So I'm very pleased we just got a small sliver of one. They're all going to be pretty busy. So, whatever you can. And so what I want to do is empower you and the Board of Health so that you can make the decisions you need and still keep track of those budgets and expenditures. It'd be awesome if we only spend $15,000, but we might be needing to be prepared to spend 100 times that amount.
Well, I would certainly, I'll make a motion that we allocate up to $200,000 to you to be used in emergency management and the Board of Health for funds that are available to pull down as needed for supplies. Reporting to us, we're going to be meeting twice a week. So my motion is for $200,000 to be used with the departmental discretion for emergency use.
Well, so maybe if I can clarify your motion, was it for both departments or just the Board of Health?
Both departments.
Okay, if I could request, so there's separate departments, so if you could separate those for me, and I will support the number I mentioned before, which was $500,000.
What about the other department? We were looking at adding cleaning staff.
Maybe
Keep them separate.
that's kind of where I was going at budget. I wanted to address these two, and we've got a lot of other budget items, but since they're at the podium, if the board has a chair, we've got a motion on the floor.
Can I, before I decide if I want to second that, Ann, where did you come up with the number?
And what department are we talking about?
I'm talking about the folks who are before us today who are
That's
in
two
charge.
departments,
Correct.
separate departments.
So are you saying 100 and 100?
No, I'm saying $200,000, you both can apply that. Your meeting,
They're separate budgets. They gotta be separate.
how would you?
they're separate.
What would you suggest?
They just have to be separate, so I need to know the numbers for each department. They're
Tom,
separate
do you
budgets.
have needs as well? Yeah. Okay, and you may need to hire staff,
Yes.
so would you each want 100,000?
Can you call the motion?
Okay,
I'm
there
not-
was a
I'm not
motion
seconding
made
it.
for 200,000 for the two departments. Is there a second? Motion dies for lack of a second.
Let me try this. I would like to just do the Board of Health first and then EMS second. So I would like to make a motion to do a budget amendment for fiscal year 20 for the Board of Health for $500,000.
There's a motion to add up to $500,000 to the Health Department budget. You said Board of Health, but,
I'm sorry, Health Department.
okay. Is there a second? I'll second it. You had mentioned just with the VNA, 45,000. Are you considering increasing the permanent part-time position to full-time during this time?
We actually, working with Dawn, we were able to increase her to full-time.
Okay.
So she is.
I think that's a good move.
Oh my
Okay.
gosh, yes.
All right, and I think there's things that, even though we are gonna be meeting, does take time to run things through, so I think having this, to draw on, and I think Patrice, your, background is, you're not even gonna ask for it unless you need it, but we want you to have it, so, all right?
And that funding is, things are moving really quick right now. If we get a local outbreak, community outbreak, it'll move even quicker. And I want those funds to be available for our Board of Health and our health professionals to advise and expend. Our trust is with you. You have our funding behind it.
Okay.
And I perceive that to be too big of a number. I would like to have more control over how we spend our funds than a blanket adoption of $500,000 when your request is gonna be max of $45,000 need. We're gonna be meeting frequently, and so that would be the reason I think we need to use
All right.
greater constraint.
Any other discussion? Did we have a motion in a second? All in favor signify by saying aye.
Aye.
Aye. Opposed?
Nay.
Carried 2-1. Now let's deal with, emergency management.
Tom, you just heard what we did with the Board of Health. Do you have a recommendation in the hundreds of thousands?
Yeah, well, since.
We need to deal at a higher level.
Yeah, I would make a suggestion in my budget, since I have to get all the mayors, the Board of Supervisors together to amend the budget. We do have that $200,000 hazmat line item in there, so that would give us a spending authority without amending the budget. So if we could, supplement that area, and then we would do our budget amendment sometime and come in, but.
Sorry, I'm confused on that,
think with what I would
I'm not
need-
following you.
Well,
But maybe, what do you need?
yeah, well,
I mean, is
if
it
you were to do the $200,000 for that,
200,000?
for the emergency management, I think
At
that
this
would be more
moment?
than enough.
Okay,
to
I will
work
make a
with the
motion
Board
to budget, or modify the budget for fiscal year 20 for $200,000 for the Tom Burgers EMS department.
Is there a second? I will second it. Is there any discussion?
Tom, do you need an additional $200,000? Wouldn't you be also looking for the city of Dubuque to be contributing to this fund as well?
Yeah, it's, for what I'm looking for right now is, it would be less than that from the numbers that I come up with, but, again, it's a separate budget, so we'd work with our board,
If we have a community outbreak,
then we
would
might
you
need
be,
more.
would you be pleased to have $200,000 in your budget?
Yeah, I mean, we're not gonna spend it unless we need it, obviously.
Exactly.
So we have the spending authority.
Is there a time to be prepared? I know you're being prepared, I'm preparing our budget.
Are you asking for money today? Was that on your
Yeah,
intent?
I was gonna ask for money because of, for one, getting hours to get some part-time help in there, people that are trained
Right.
on incident command.
We
that can
talked
help
about
us in
that a
the
couple
EOC.
weeks ago, right?
Yep.
And do you need $200,000? I guess that's my question.
I thought we were looking for, the direction was to get something, spending authority that we would be able to use, you know, so we don't have to come back and amend the budget, but, at this point, I do not have requests for 200,000, no. Do I know what's gonna happen the way the last week went? I have no idea, you know, what's gonna go on.
Exactly. Okay. All right, any other discussion? All in favor signify by saying aye.
Aye.
Aye. Opposed?
Nay?
Carried 2-1.
Thank you, Patrice. Thank you, Tom.
All right. We have,
Do facilities, A, or?
number 2, 2A, determination of operation and facility closings.
I think we should step into that, you know? Step into that, does anyone want to lead? I mean, we're all here together, so I mean, let's start with the, you know, just maybe the courthouse. That's one of our largest operation centers, so if there's an elected official that would like to speak and lead, or Dawn, if you want to speak on behalf of some of the courthouse employees, I am leaning towards, my direction is to close the courthouse at the end of 5 today for public processes, but I want to understand the impact of that and potentially the impact of the courts. But that's the direction that I'm heading, and I want to hear comments and questions. I don't know where my colleagues are, but just open the dialogue.
Well, I guess maybe I could speak to this as well. I don't think that we are in a position where we should be closing the courthouse. I think we can look at restricting and limiting as each department feels is necessary with regard to their own individual processes. But I'm not sure that we have, at this time, the need to close. I think that might send a signal to the public that we don't want to send. I think there should be some orderliness to this. Some folks can work more easily from home, others can't. We can certainly move things back and restrict hours and say we want to move with pilot projects toward folks working from home. I think that that's a reasonable, prudent way to go about business, but being closed within the next 2 hours, folks will leave at 4:30, I think is, you know, maybe a little fast. It certainly is going to be for me. So as you department heads speak, I'd be interested in knowing what you can do to speak to your department's way forward, but also what planning you've done. And, you know, some of these are going to be essential services, and I don't think we can just preemptively, upon 2 hours' notice, close Dubuque County Courthouse business or close it to the public. There's major stakeholders that are not present in this room. Court system.
I have had some discussions with some of our department heads and elected officials. I think we should be looking at what we can do remotely. I don't know that I'm there for closing the courthouse. I think there are essential functions that we would need to keep the doors open. But I think I would say severely restricting access is probably heading in the right direction. I want to hear from the staff. So Jenny.
Agreed, but this is, just last comment I make, this isn't unprecedented. So Polk County, the largest county, is moving that direction. Our neighbor to the north, Clayton County, has on their website, effective immediately until further notice, blah, 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 office listed below or closed to the public. So we're not alone on this, but that'd be my last comment.
Okay, Jenny?
The Iowa Secretary of State told us that we're having our June 2nd primary no matter what. They are not changing that date. I am still in candidate filing deadlines. I have to be open this Friday to accept, till 5 o'clock to accept candidate filing deadlines for the November election. And then I have to be open the 25th until 5 o'clock. And during this whole week, next week, 25th at 5 to accept the primary candidate filing deadlines. people still have that by law. So we cannot close, or I don't know how legally, if people wanna file, we're getting late for them to get it mailed into us. If there's problems, if they do mail it in to me, I would have to mail it back and tell them there's an issue with it. They wouldn't have time to correct, to mail it back. Mail does not work for candidate filing deadlines. Something that we are working on and what the Secretary of State has recommended for the June 2nd primary is to encourage our voters to do the vote by mail. Not vote absentee in person, but vote by mail to avoid going to the polling locations coming in. I am working with a vendor and working on a mailer. However, we did not put that in our budget for the June primary to mail absentee request forms to all the residents to recommend they vote absentee instead of showing up to polls or come and vote in person. A big concern is with our polling places is, and we're still working a lot of stuff out with the Secretary of State, is that they're recommending we combine polling places. Our workers, their medium age is probably over 65, so we're worried about not having like workers to work the polls, and we have to have some polling locations open. But there may be less workers, so there might be longer lines at the polling places in June, and that's why they're recommending we mail out the absentee request. But we would be asking for more money. I'm still getting quotes. It's still hard to know exactly what I may need because we hadn't anticipated this. But as far as closing the courthouse, I have those deadlines that I have to meet.
So it sounds like your department's gonna be in flux elections, with good reason, and so it's good that we're meeting again.
And Jenny, have you looked at any of your functions that can be done remotely?
It's hard to work from home because with your absentee request, we have to get them by mail. If you send me an email of your absentee request, you have to follow it up by mail with the original wet signature, and we have to verify that. Mailing absentees, I can't take ballots home. I mean, that's against all election security policies. So when we get to, once we have ballots, they have to be stuffed here, and then we have to use our postage machine. So a lot of our processes are hard to do from home. Getting people to not come in and to say, here's an absentee ballot request, fill it out, mail it in, because we'd rather have you not go to the polls or come in and see us, we'll mail you a ballot. We can encourage that, but a lot of our processes are really hard to do from home.
Are you getting any new guidelines?
Has there been any discussion?
Getting guidelines of 10 people from the president?
Has there been any discussion on just mailing a ballot to everybody?
The Secretary of State has said that that is something that, I mean, they're working parallel and they're trying to keep us up to date with information as when they find out stuff. The biggest drawback to that with just mailing people ballots who didn't ask for one is in a primary election, it's a nominating process. So there's the Republican ballot and the Democratic ballot. And then you have people registered as no parties. Well, what are we mailing the no parties? 2 ballots? Like, we don't want to do that, and that's gonna, I mean, so right now, there's been talk about it, but I don't know if we would get to mailing everybody a ballot. The big push has been to just have people, if they want to vote in the primary, request an absentee ballot.
Okay. And I trust that you'll be trying to have your input, make sure that the most people get a chance to vote.
Yes.
And that, yeah.
And that's why we want to work on this mailing. Again, more than likely, we're gonna have to ask for extra money for our budget because we didn't put it in, but we want to get a mailer out that has that absentee ballot request form with the prepaid postage to come back to us that says, instead of voting, having longer lines because we may not have workers, if you want to vote in the primary, request the absentee.
The information I'm seeing is just that the president has recommended that no more than 10 people gather. at any time. So, you know, this could all be decided by other people within 48 hours as to whether or not we're going to be open for anything. But, you know, I appreciate your point. I don't know how we'll do no more than 10 people.
So, yeah, I'm just interested in what your needs are for the courthouse, so thank you, that's
Okay.
good. We've got like
So
8 more, so let's keep it
You'll
moving.
let us know
So
if
you
you
need
need
to be
to amend
open.
your budget.
Yeah, we'll definitely need to amend it, and I'm still working on getting
Okay.
hardcore numbers. I mean, I wouldn't think more than 50,000, it should hopefully be less, it's just hard to.
My
We're
fault for
handing out
interrupting the
200s
budgets. We'll come
today.
back with the budgets. Let's stay on the facilities and operations.
All right. John Murphy?
County Recorder. First thing I just wanted reference to is that the president did reference to less than 10 is the new recommendation from the White House Task Force. And just as give you guys some scope of what is falling on your laps eventually is that he was also quoted this morning telling the governors to try getting it yourself when referring to respirators. I think this is something when you're talking about these large budget allocations, there may be things on your plate that we're not cognizant of yet. So I just thought that was timely, given that that's all occurred since we've been sitting here. But, you know, I look at this as a challenge for all of us to be showing leadership in whatever department we're in. With what I'm looking at for our office is that almost all transactions can occur through our website, online services, and through the mail. Direct face-to-face contact, I do not think is essential to do our operations. While I may want some ability to bring people in under one of those maybe monthly or quarterly concerns that pop up that do need to be addressed absolutely today. You know, I think that's something that we want, but the 3 goals that I have to address all this is, 1, to do our part, however large or small as just my department is to help flatten that curve. Number 2 is to protect my staff. And number 3 is to protect our operations. My plan is to separate my staff into 2 groups so that when one of us are exposed, and if we have to go into self-isolation or whatever is the medical experts are telling us to do for 10, 12, 14 days, whatever that timeline is, 14 days, that Team A, you're now all on the sidelines. Team B, you're here until Team A can come back. I have that plan in place. My hope and expectation is to utilize this plan very soon. I really hope to not do it unilaterally and to do it as a group here at the courthouse, because I think these are all of our responsibilities. I did put all that together for you guys to review. Again, it's really specific to my department. I'm not sure how it applies to everybody else, but I think there's ways to make, you know, my thought is that, yeah, we're gonna keep county government open for business, but might have it closed to the public at the same time. That my staff can be here, we can do everything that we need to without having our public doors open. And it's something that, again, since moments before I came up, we got guidance from the Iowa Department of Public Health for all of our offices. And this is what they are telling us to put up as soon as we decide. So I think the conversations are almost inevitable. I'll read it, and I'll give you each copy, but it says, "Attention customers, this location is temporarily closed. Requests for vital record services have been temporarily suspended. Ordering options," and it goes through all the options, and this is the type of things that we'd be putting up maybe in the lobby or in an area that the public can access and identify, oh, this is who I need to call to get something done, so.
Interested in the details, if you don't mind, if you want to read that or provide me with a copy of it, but.
Yeah, I'll give you a copy, but.
So what are the details,
Can
John?
we put it up on the screen?
I just printed it off right before I left.
And this came to you from the Iowa Department of Public Health?
Yep, and this is specific.
So again, it'll be a 4:30 conference call for you.
We'll advise we won't have too much time to go into details on every department, every scenario, or we will not be able to act.
But my point is, we do essentially 3 operations, one of which is real estate. That's the vast majority of our staff time. That we will continue to do through e-submissions. I think we can actually have an uptick in our e-submissions, and then we can also receive it all through the mail. Number 2 is that we do vital records, and that's what this Attention Customers is focusing on, and it shows the ways that the public can still do all the same transactions without coming in, being face-to-face. And the third component is the Department of Natural Resources, where we do boats, snowmobiles, ATVs, and that's the same thing, that we can do all that stuff online. I think it's our responsibility to figure out ways to deliver our services without putting anybody in harm's way by putting us in the same room.
So would you be open to putting a call ahead to the county recorder number on here? Or this is just?
That's what we would be doing. We'd be directing everybody to go to our website or call first. I don't want anybody coming down to the office right now if you want the truth. And it's just a question of you know, are we able to come to something that works for all departments, or do we have to make individual decisions about what's best for our staff and for our operations?
Okay. I like your plan, like your vision, your ideas. I would support those.
Thank you.
Right?
I'd love to hear from
Who's
Judge Schubat.
Judge
The
Schubat?
judges are very important, and you're a big component of the courthouse. Any updates from what seems like?
Yeah, so I think, you know, everything's moving so quickly here. I think you're aware of the statewide order. The branch is taking steps to try to reduce traffic dramatically in the courthouse. And toward that end, we have, at least the Chief Justice has decided there will be no more jury trials. Criminal jury trials through April 20th, civil jury trials through May 4th. That's going to cut down the amount of traffic that we would have coming through and basically takes all of those things off the docket. And as things go forward and progress, we'll see what happens with those dates. They certainly won't move up, could move back. At this point, where we're at is still trying to adjust to the changes over the past 48 hours. We understand that there may be a need to close this courthouse. So I guess what I want to express is what our needs would be if that's the action that you feel it's necessary to take. So we'd need to have access for our judicial branch staff to work in the courthouse, but behind closed doors. And certainly the clerk would need to have some staff. We may be reducing staff depending on how things proceed, and we've worked on plans for that. But we would need to have that. We would need to have a space. Wouldn't necessarily have to be in the courthouse. We talked about the old space in the law enforcement center, but we would need some space to conduct emergency hearings. Assuming we have access to the courthouse, we can do all of our initial appearances and those types of things over the video system. We have a good video system here, so those could be conducted by judicial staff here at the courthouse. But we would still need some place if we didn't want to have any traffic in the courthouse. The other thing that we would need is the clerk has to have some type of way to process emergency applications. So I'll give you two examples of what we're talking about. One is the abuse emergency applications, so that'd be domestic abuse, sexual abuse, elder abuse, that typically are filed by self-represented individuals who come in, and the process is they come to the clerk's office, the clerk helps them to fill out the forms, they process the forms. Those forms are seen by a judge immediately, and then the judge can enter ex parte immediate relief, in other words, on the spot. The other type of proceeding that would be an emergency thing that the clerk would need somehow to have access to the public for would be a mental health or substance abuse commitment where someone is presenting a danger to themselves or to members of the community. And in that very similar process, a little bit more involved, but just self-represented people coming to clerk staff, filling out the forms, getting them filed, and then the judge taking action immediately. So it's not something that goes on the pile for us to just look at later. So there would need to be some mechanism or procedure in place that if somebody was, and by the way, I mean, those types are the types of applications that we suspect could ramp up during this time. So we may have more than our usual share. But we would need some procedure for the clerk to be able to meet with those individuals, get the forms filled out, and get them in front of the judge. those are really our needs. We can do everything we can to limit it, but that's what we need at a minimum.
I heard Judge Whittig, I came up the elevator with her, with Chris present, and we talked about putting some kind of plexiglass, getting some kind of a window space that's protective for the information office for the clerk of court, or for the judges, to put something in place to kind of make more secure those kinds of individual face-to-face encounters. What do you think this would look like in terms of what would you like to have be for safety protocol if there's somebody seeking a domestic abuse protective order? How is that going to be, how do you see that being done? What do we need to modify, I guess? You know,
Well, typically those, and I'll allow John to speak to that, but typically those types of meetings are kind of a one-on-one, for the most part, meeting. So there's some social distancing that, I mean, you can do, but you're still handling the same piece of paper. I mean, we do have an electronic system, but it starts with a piece of paper, you know, for emergency applications. I mean, certainly I'm in favor if the courthouse is going to remain open, we'd like to have some plexiglass. We're not able to close off our court administration stand because that is also our check-in point for hearings. Every courthouse is unique, and that's just the way ours is. Other courthouses are closing off their administration offices altogether.
Any questions for Judge Shabbat?
well, I guess to me, it seems that it's not really possible to close that function of the court system. It's not.
We need some way to process it. I don't think that for our part, with taking down jury trials, taking them out of the equation for a while, and there are a number of other steps. The people in our branch have been working very hard to try to eliminate traffic, and I won't go through all those. I think I might have mentioned one or two of them on Friday, but we're not having people come to the courthouse whenever possible. We're holding telephone hearings. Obviously, it's a challenge for us if the courthouse is closed, particularly if that decision is made and we have to start, as early as tomorrow. We will figure out a way if we have to, but I guess my goal today is to tell you that at a minimum, we need to be able to perform those functions. And the other things, they're a big challenge for us. And I think you understand that. I'm not trying to convince you of it, but at a minimum, we do need that kind of access, and we need some access for people who are in emergency situations to file those kinds of abuse petitions and commitment petitions. So I don't know how that looks. I don't know if there's somebody stationed at if the courthouse were to be closed, if there is any security at the front door and somebody comes to the courthouse door and says, I need to file this petition, that person's gonna have to come into the courthouse. We can't just ignore that request for relief. Everything else we can put off.
Okay.
It's good to know. Thank you.
Chris, you have a comment? I think you're gonna need to go to a mic, Chris.
Thank you, Judge.
Thank you, Judge Shuba.
Thanks, Judge.
You might, if you.
Okay.
I haven't had a chance to meet with all the department heads and the judicial branch as of yet today, but one of the things we were looking at is closing and locking the inner foyer doors. Work with IT to get a phone out there so they can push a button to get a hold of clerk of courts and somebody can come down and escort them in and out, or any of the other departments that would need that immediate access to a given person coming into the courthouse. This would allow us to control everything. We'd also put table and everything out there with the correct forms that people need to fill out if they couldn't fill it out online, but it would limit the access of the public into the remainder of the building. Is one of the things I had started working on this morning, and I talked to Jenny a little bit about that, and I talked to Eric, and I talked to John, but I haven't had a chance to make it through the entire building. Would that?
I think that's
I like that idea.
I think it's a good start for a discussion. I'm still not convinced that locking the doors is possible with, so far, elections and the judicial branch expressing their concerns, and we haven't heard from other departments yet. So let's,
But we do have flow that comes in and stops right there for security.
Yeah.
So, you know, we're in control of who's coming in and out. So that checkpoint could be reconfigured to meet some of these criteria. Courthouse is closed to non-essential items. These are those essential things. And refusing, Shane, you're here, refusing people to have access for assorted things, I guess, you know, to be screened right there. You're already doing that through security measures.
yeah, depending on staffing.
Right.
We talked to
Well, I
Treasurer
don't know that we
Stearman, I'd
can
be
lock the
curious to
doors and have
hear Eric's-
access to pro se immediate relief.
his needs. Before we start solving it, I'd like to know the needs of the departments, and you're a big one because you get a lot of traffic.
County Treasurer Stearman.
So we've spent the morning this morning just trying to alleviate some things. We're gonna close. We have an office in Dyersville. And I believe Dyersville, they're meeting tonight, but I said, well, we're just gonna close in Dyersville, so we're not gonna have any presence in Dyersville at all from now through whenever. Locally here, you know, in our office, we have all the dealers that make drop-offs every day with all their things, and now we've made arrangements with them that they're gonna be dropping their things off in Dropbox behind the building. We're gonna be mailing everything out from our office after that, because they won't be coming in to pick them up, so they drop them off, pick up, that type of thing. We're probably looking at, probably roughly between 5,000 and 8,000 people in the next 10 days coming into the courthouse for whatever reasons, you know, and those reasons being property tax. And it's, you know, unfortunately, it's just like a habit that they're gonna come in and pay them in person, you know, that a lot of people have that in mind. Now, with that, we can do, like John there, we can do pretty much we would be willing to work with anybody to do anything. Can you pay your taxes online? Yes. Can you mail them in? Can you drop them off? Yes. Is there any extra fees for that? You know, to pay online, if you paid with a debit, not with a debit, but with a checking account, it's 25 cents. If you pay with a credit card, it's 2.25%. You know, checks and cash or checks and, I guess we wouldn't want any cash in the drop box.
Not a 2% fee, it's a $2.25 fee, right?
2.25%.
To pay online?
Yes, with a credit card.
Oh, okay.
With a
So they're
credit
paying the
card.
fees.
So it's the credit card fee. So with a lot of our other stuff, it can be done online. It's just, you know, it's that coaching, you know, where's the form? How do I fill the form out? What are the things I put on the form so I get the information? You know, those are the things we're more than happy to help people out online. You know, if you have a car, you know, people just feel they have to come down because we need the signatures.
My husband came down this morning.
Did he?
Oh, yeah. I
Well,
said, I will
we've
be
had a
there
number of
today,
people in
fool.
today. It's, you know, but that's just the nature of the beast, you know, with that. And so whatever decision, I understand where you guys are at. And whatever you do, we do, you know. It's, you know.
Well, we're looking for your wisdom and leadership as well, not just to look for us to make the decisions. You
But
do
we
this on a
can-
daily basis. You work with the public, you're elected official. I need your wisdom and your thoughts.
My theory is that we need to take care of the people. You know, now, if we're gonna do something, we need to get something out there now to tell them, hey, we're looking at reducing or eliminating access to the courthouse, and here's your options for doing the things that you're immediately looking at doing. So let's get that, you know, because that's what I'm waiting on. I'm kind of waiting on a decision here, so we always put out a press release that, hey, taxes are due, you know, here's where your options are to pay them, here's how you can pay them, and here's the hours we're open, and here's the penalties, you know. Now, Ann had mentioned the other day, we were talking about penalties and stuff. I don't see where that would be too big an issue, you know, because there is plenty of time to pay yet, you know, it's not like a last minute type situation where.
Well, I asked our state representatives, Lundgren and James, to look at that too at the state level. That's what they're doing, is
Sure.
their wrap-ups, to see if they're gonna be considering those kinds of checklists
Sure.
of things that they can help us with too.
So Eric, you said 5 to 8,000 people typically. I mean, I know it's not typical times right now, but would come in and pay in person. So
And that's between motor vehicle.
I understand.
Yes, that'd be
So,
everything.
how many of us have seen the airport scenes at O'Hare and DFW on the news with the folks trying to get back into the country? We don't want that situation, right? With this community spreading of this virus. So if we're going to have the courthouse open and you're going to have people at the windows, and it sounds like that may be in your view that's necessary.
Yeah.
How do we limit the number of people in line? I think we need to get with Shane. Do we not let people in until, you know, it's not congested? We haven't done that at this point. People go through the line and they're free to go wherever they want in the courthouse.
I had shared a list with Dawn there, you know, as far as what's required to be done in person and what's, you know, what you can do online and in person, and restricting the entry to the courthouse. But if they're standing there, it's important, you know, regardless of what it is. You know, if it was to get a drink of water, it would be important to get in that courthouse to do what I have to do because I'm here. That's kind of the mindset of people, that whatever they have is important and they need to come in and do it.
It's important to them.
Yes, yes.
Right.
Numerous times where you'll have 20 to 30 people in a line.
Yeah.
Especially your peak times.
So maybe with that information, I believe this to be true. You're gonna be put on the spot here. Our health director, what are you advising us? Do you wanna have that scenario occur in the next 10 days? And you go to the mic, please. But that's if the chair will allow this, you know, is that what we wanna happen? And if not, then we need to change things.
I would feel much more comfortable once I know what the CDC and IDPH recommendations are for the social distancing. However, they're still telling us 6 feet, so if something could be done to only have a few people come in and stand in line, that there could be that 6 feet. For right now, I would be okay if that were to be the plan. But if we do hear this afternoon that they don't want more than 10 people in one area, if this is a vital department that has to stay open, it could be worked. However, I would recommend that everything be wiped down between people, and that would be time consuming, and I don't know if that would cause
Frustration for the public more so than having them stay at home, so I'm not helping them.
There's gonna be a lot of frustration out there outside of
There is,
paying
either
your
way.
taxes.
Either way.
I guarantee you that. Eric, do you have thank you, Patrice. Eric, do you have an estimation, a guesstimation of the amount of revenue that comes through in the next 12 days that we're
I
talking
want to say
about?
we have $40 million that we have to collect from taxes yet, so.
Overall, but in the next 10 days, physically downstairs, what's your guesstimate? So let's say if hey, you can't come in, what would the revenue loss be? Related to, I mean, it's not gone forever.
Sure.
Deferred. Is that, you think it's 10 grand? You think it's 100 grand?
Just talking to Patrice there, just hearing.
If you have 7,000 people, what's the average bill?
But if we have, so if people are coming in and then there's restricted entry, you can't go in, well, but here's your other options. You can drop a check here, we give you an envelope there, we do this, a lot of those people would at that time turn around and say, oh, well, I'm not gonna stand here and wait, they would take that option and mail, or perhaps put in the drop box or whatever, and that would probably be a good system. I just have a hard time. Friday after the meeting, I was out and I saw some people and I had people asking me, well, I hear they're gonna close the courthouse. I hear they're gonna close the courthouse. And he goes, I think that's crazy, you know, but that was the comments I got. But, you know, it's all based on the knowledge that you have of this virus, you know, and, you know, this is an important topic to be addressing, and we want to protect the workers and the public, and yeah, it's could have happened the 15th of April. Nobody'd care.
Is there?
Yeah, there's a Dropbox.
Yeah.
Yeah.
So,
It's two of them,
Okay.
Chris is saying.
so it sounds like what Patrice is saying is that, you know, we need social distancing. Our health department is recommending that, we follow it. And so we can't have what you're having now, so we're definitely gonna be changing some procedures. It depends how drastic. I would challenge the board to look at what is the reward of serving the public, having them pay taxes, having whatever the number is, come here and do their transactions versus the risk, okay? What are we gaining by having thousands of people come to the courthouse? I'm not talking about employees, okay, it's a little different, but access to the public. That would be my challenge, is that what are we gaining other than being an outlier from the rest of the community? You know, they're talking about, obviously, just go on social media and even Dubuque. We're working on closing casinos. The schools are closed, on and on. So, you know, sometimes we look a little bit too internal. There are methods to solve. There are methods to delay. That's what I would encourage. And if we need to waive fees, we need to reduce collections related to normal processes, now is the time to do it. We are very fortunate in Dubuque County. We have a good economic base. We've got good fund balances. We've got intelligent people. I think it's time to act differently. And so I would really encourage us to act more progressively and act more decisively related to changes in our operation.
And we are working toward that, but what we're doing is having each department start to put in place. Eric, you've made several changes since we were here on Friday.
Sure.
Right, and so we'll be back together again on Wednesday. This is unfolding by the hour. So I think, you know, we can come to some consensus
Do we want to
about
wait
limiting.
till Wednesday? We have childcare issues. Everybody who comes to you, they all compound.
I'd like to see at least some notices that, hey, we need to please make an effort to pay online or pay, you know, drop at the Dropbox, just that.
Definitely would communicate, over-communicate, try to over-make, you know, comply, make things easier for people to do online and to understand where we're at. Gathering in crowds and public spaces where a lot of people meet, not really in vogue right now. Okay, and there's a reason for it. I think if we can look back on this and say we've minimized an outbreak, we've reduced any or all deaths, and we might have overreacted, I'm okay with that.
Sure.
I will take that scenario. The opposite of what's occurring throughout the world is not what I want in Dubuque County.
I would like to see your department continue to put in procedures that limits the amount of contact you have directly with the public. We can start working on fixing solutions and reducing that contact, or we can continue to hear from departments. I think no one in this room thinks it's business as usual even starting tomorrow. I imagine the recorder's gonna go downstairs by 4:30 and announce he's got a new way forward, right? John, you're saying,
I hope
you're
so.
going, you've got a plan, you're gonna execute it. You're an elected official, you have the right to do that, you've got everything you need from IDPH and the Secretary of State supporting you done. So what else can we do to help you, Eric? I mean, you've got to come through those final solutions, but I think we've got great things. We can start to really limit who's having contact with the public.
You know, I think delaying of payment, you know, I don't think we're at that point right now. You know, there's plenty of time to pay taxes. That's what your penalties are coming on for. So I don't see any reason, I don't need any money in my budget. You know, the only thing would be is that if we're going to be mailing everything out rather than, you know, we may hit, but that also, you know, that goes back on the customer. The customer pays the mailing fees, you know, so there really wouldn't be any effect on the budget. There wouldn't be any effect on the, you know, not with my office, so.
Eric, I know that a few years ago you started doing an annual mailer instead of every 6 months.
Yes.
In this time of emergency, would you need extra money in your budget to do a mailer to keep people from coming in here?
Well, even anything we put together and mailed out would be a last minute thing, but what we have right now is that the taxers are due in March. We send out a delinquent notice in April that says, hey, you forgot or something, you know, but, I don't see where well, people are aware that taxes are due. You know, if you're saying send a reminder out, is that? And
No, I'm saying, you know, maybe, some people, instead of coming down to pay that, if you send them, an envelope, they can utilize, and something that says, hey, we wanna minimize crowds
We
at the
send
courthouse.
envelopes with their initial,
I understand that.
with the initial thing, and,
Right.
you know, I guess basically, you know, do we have it on the website, you know, on our Dubuque County website, you know, that, you know, hey, we need to, you know, please alleviate coming into the, you know.
So are there functions that can't be done remotely in your department?
Well, the issue is what we're doing is we're doing motor vehicle titles, and we have to receive the titles. So the titles are received in the mail with the elections and with John's stuff. We receive everything here at the courthouse. And all the printing, you know, because it's specialized paper, it's all that type of thing, that's all at the courthouse. And so processing of taxes, you know, so we receive the taxes here, you know, if they're online, well, then we can process them from anywhere, but we're talking at you know, just a minimal effort there. And passports, you know, I think probably the passports are probably not an issue right now, you know, that would be something we don't have to be getting into, but essentially, we're kind of almost locked in to being here, and I talked to Nathan before, and he says, you know, and let's face it, you know, we haven't been thinking about this since Friday, so for 80 years, we've been doing the same thing down there, doing it. We haven't, you know, had to give a thought to how we would do it differently if we were going to. So I guess we have to do a little out-of-the-box thinking to see what we can accomplish. But right offhand, I see it kind of difficult to do because they don't have the information they need to be one thing. They can't print it there at home. And it just gets to be a tough situation there.
It's okay if it doesn't happen.
Right.
It's okay if it doesn't happen for the next 10 days.
Sure.
Okay? So you can go through a million scenarios, but it's okay if it doesn't happen.
Right.
But it's not okay if we put the public at risk and put them next to each other.
Well,
So I
and
don't
the
know,
thing
I
is,
would
you
like
know,
to not go through a lot of scenarios how to solve all these problems.
But
So
there
I
are
think I
some
have,
things that have impact. License
And-
tags,
and let
if they
them
are not
solve them.
renewed, that becomes a criminal offense if you don't display the correct tag. You get pulled over because it's probable cause, because you don't have a valid tag, and then
Mindset
on you
after-
go, right?
It's hard to change your mindset after 30
Sure.
years trying to provide good service and then say, well, you know, we don't have to do that in the next, you know what I mean? That's just a tough thing to overcome is that, you know.
I'm here to help you with that.
Right, gotcha.
So, but we'll need your wisdom and your operations related to the decisions, so, but appreciate that.
Yep.
Thank you for helping us.
Thank you.
Dave?
Real quick, just real quick elaboration, I think that Chris referenced, talking about having some sort of material and table out in that small lobby area between our two sets of doors. The thought process for me has been to place a table out there that would have contact information for our staff. So if they have questions about what they're looking at for that birth certificate, whatever it is, they're calling directly into our office. We walk them through it. If we need to have a notarized signature, we come out, we can do that right through the glass. Same thing. I think there's a way to communicate with people without them having to come into our doors. And, you know, probably 20 minutes before I came up here, we had 17 people in that small space that's in front of my office. I don't know how to keep people out without locking those front doors or having some sort of very drastic screening process from the sheriff's department with our front security. So, you know, and that was my 2 cents too, is if we have maybe 2, 3, 5 candidates maybe that need to file their papers by the end of the month, they can literally come in, make a phone call, and whether it's Jenny or security, escort that candidate up to the auditor's office. I think there's ways around this, and we just have to be able to be flexible as individual department heads and elected officials to make this work.
I would agree.
Thanks, John. All right, other departments?
Yeah, well, you know, we'll hit West Campus, I think, first. Would like to departmentalize this if we are talking, but if you're talking about courthouse, feel free to. West Campus is on my list. West Campus is on my list as well. I just wanted to handle one at a time.
Otherwise
my brain gets a little.
Courthouse department.
Megan,
Denise is sick with influenza A, so.
sorry to hear that.
Yeah, I know, I got a text that said,
Sorry to
thanks a
hear
lot.
I hope
so-
that's what it is.
So her only concern is that accounts payable has to be here to cut the checks.
So
On a weekly
internal,
basis.
what's your public access needs? People from the public, do you have any?
I think Mary has a few liquor license or stuff like that, but
Little or none? Okay,
budgets need to be dropped off by the end of the
so
month.
you'd love to come here and work.
I can think of, Mary, I can think of if we have any bids, if we have a bid deadline, there would be some traffic, not a lot, but
Assuming we move forward with those,
I
yeah.
think the auditor would be a good pilot to work from home. There are
Yep.
individuals there that could show us if it works in case we're in this situation. I personally feel once we close, it's almost impossible to reopen. When's that safety, when do you turn that corner? When's that, when are those numbers mitigated? So, but
Cross that
if
bridge when
we
we
can
get
look
there.
at people working from home, staggering, we're gonna need, the procedures and the answers from the auditor's office.
Thank you, Megan.
thanks, Megan.
I just wanted to bring up one point that I want us to think about is that we do have 2 public hearings on the budget next Monday and how those happen. Just be aware of how we're gonna continue doing that.
And I think that's a great point, and I think that's where our technology's helped us. We're in good shape
Okay, thank you.
in public access, but good point.
Stella, but beyond that, is the budget department able to work from home? What is do you have any input with public? I mean,
You've tested it.
Thank you.
Very good. So I'm CJ May. I'm the county attorney. A couple of, I guess, 2 things as I see it is like an access to the building and then our access to the public that literally comes to our office. That second part is very minimal. Probably the most folks that come to our office would be the law enforcement stops in and they discuss their matters, and then victims. Some witnesses, I suppose, but that between the victims and the witnesses would be certainly something we could do via email. If there's forms they need to fill out, we could send them, they could fill them out and email them back. Telephone, of course. So I don't see my office needing a lot of public access. Certainly, we work very closely with the courts now, so kind of good and bad. When I started, we converted everything to the electronic files. So all of our case files are in a piece of software called Judicial Dialogue. So that can be accessed anywhere, from a tablet, a laptop, a desktop. And we're working with Nathan and Jared right now to get VPNs for everybody so they can literally access it from home. So that's good. Bad would be, we do access law enforcement records through I guess it's software called RMS, and that's a dedicated line literally from one terminal we have in our office across the street. And as you know, the law enforcement center is on the city's server and on all of their computer systems, so ours doesn't really talk to theirs per se. So the only way we can get those reports is to go to that terminal and get those records, and then we have a process that we put those into our Judicial Dialogue, into our electronic file then. So I don't see perhaps any particular downturn in the amount of criminal activity in the county. And so of course every day, 7 days a week, we see those folks that have been arrested overnight or that perhaps have a warrant that they did not appear on yet, or an extradition matter. So every day through it's called the exchange, this information comes to my office, and then we process all of that and get ready for video court at 8:30. So, excuse me. So I see, those things, and Judge Schubach kind of touched on those, are something that will have to take place every day. Now, with the order that came from the Ohio Supreme Court and then from Judge LaClar, who was our first judicial district chief judge, they have, a lot of it's been just, like Judge Schubach said, no criminal jury trials, civil jury trials. I've issued a directive to my people to cancel all depositions, so that'll stop other people from coming in the building for those purposes. I've talked to the court, and we're commitment hearings. My attorneys would do those by phone rather than going to the hospital. So we're trying to kind of chip away at these list of activities that are going on in any given day. But I do think that, my staff would need access to the building to do their work. I think having limited access to the public is the proper way to go. Like Judge Shubat said, there are going to be certain of those emergency situations and cases where people are going to have to be seen, and until something else is figured out. But for the here and the now, that's where we're at on that. So,
What about the two victim witness coordinators? What will they do without access to folks?
well, quite frankly, Supervisor McDonough, they do a lot of their contact initially by phone. I mean, kind of three things with the victims is to, get them registered is the first thing. Victim restitution is the next thing, and then the crime victim reparation fund. So those are the three main things. But mostly they'll be talking to them about hearings, trials, depositions, and so obviously now when this is kind of going to be held in abeyance, there really won't be a whole lot to communicate about with those issues, at least for a little while here.
Do they work with people directly who file, for domestic abuse protection?
Well, so those would be like 236 orders,
Civil.
right? So those are all civil. So
Some things come with the criminal charge, though.
Oh, yes. Oh, absolutely. And, like Judge Shubat said, there may very well be an uptick in domestic, cases, unfortunately. So.
But you'll handle that by phone with coordination. So you've got a plan to reduce hours or?
Well, at this point, I guess we kind of, today was, we tried sort of business as usual, I think today, and tomorrow was the director from Judge LaClar, and I think according to her order even, I think she's anticipating. Pardon me?
I did not see her order. I saw the Supreme Court order.
Yeah, so she sent hers. Actually, we had to kind of get it in a left-handed way today, but I can forward that to you if you'd like. She just basically adopts the Supreme Court orders and then kind of talks about, because as you well know, in Iowa or in the First Judicial District, not every county has a judge, and kind of they were going to do different things, some of those.
Well, I appreciate your comment about the support for limiting public access to the courthouse. That's where I'm at. So thank you.
And I think that if, the hearings will be down to kind of a minimum, and one of the things that the order allows for is really promoting is to try to do everything by a written document, a written arraignment, a written guilty plea, which normally by rule is not allowed in a felony case, but the judges have allowed that now. So that will help quite a bit, and it also allows for any defendant to waive their presence at any hearing. So obviously it could be just taken care of the lawyers and the judge. So it's kind of where we're at in our corner of the world. All right, very good.
Thanks, CJ. Jody?
Hi, mental health. Jody Jansen. Jesselyn, my assistant, and I have started working on some alternative plans. I feel confident in talking with Nathan IT that we can use our computers and electronic files, and our database is up on the cloud. I do see that we will have to come in occasionally because of paying bills, and then we have to dump data by PDFs and stuff. But, if this gets severe enough, it's possible. Nathan said that we might even, he might purchase some of the smaller scanners and stuff that we could have in our homes. So I look forward to working with the courts and with County Attorney's Office so that we can set up some good communication to, we're ready to limit the traffic to our office.
So why, I know that when there's an emergency commitment, folks come right up to you. And I don't know why that is or what the circumstances are, but.
We like to first of all, we notify Mercy Hospital because in that way they can prepare for another admission. If they don't have a bed, their ER can start calling around to see where a bed is available, where else they could be transported. Because on those orders, on the court orders, it said transport to Mercy Hospital or other suitable facility. And that covers it in case Mercy does not have a bed. Okay, and then associated with the commitments, there is a few of the bills that insurances do not pay. And so our database requires, we have to enter a certain amount of information to pay. There's always an associated legal fee for a lawyer.
But I guess the answer is, it's not essential that you meet with people, it's not part of the court
I
system.
said that I'm sure that we can work out a system through the telephone.
Wonderful.
Okay.
Good, thank
We
you.
usually have 3 to 5 days before the lawyers or psychiatrists start submitting bills. So that's why it's nice if they can come up, otherwise we're gonna have to do a little bit chasing over the phone. Thank you.
Thanks, Jody. Okay, Troy?
Troy, see? Another couple months, you might have been out of here.
Yeah, short timer, right? Troy Patzer, Dubuque City Assessor. So most of the things we do, we could probably do on the electronic fashion. Good thing is over the last several years, we've gone with, everybody probably knows the Beacon Schneider, so a lot of the information that a lot of people from different companies and just individual taxpayers can get all that information online, so that's great. And over the last few years, we've had more and more people applying online as far as when it comes to appealing on petitions. They can file that. That's already been things that are passed in the code that can be done. So we can have electronic submissions already for all the credits and exemptions and petitions. So it would just be getting the word out there, working with IT, maybe one of our other vendors on Beacon, there is an app on there that they can have a link that would have a fillable form. So it's something that we've already been in discussion with creating with the new county website as them forms are. So we can possibly, maybe we can just get that going a little bit sooner. So I think with that would really limit traffic for that. Our office could probably do most things at home if we have good backup where we can, everything is connected in here to the courthouse. If everything is in with as far as Tyler and all of that goes with our tax administration software, that would be just fine. There's plenty of little projects with things if we can bring home scanners and stuff like that we've already got, so we can just do them rainy day projects that we work on at times. Maybe that'll just be our priority if there's certain functions that we can't do. So that part we'd be okay with. Speaking on behalf of myself and with the county assessor, Dave Kubik, we're in a critical time right now. Is basically April 1st is our deadline to send out notices of value. So we're working on that. We've kind of got a deadline between us and the county of early next week with our vendor. So it's providing that the mail system is still going, we'll be able to get notices sent out in a timely fashion. We have an April 1st deadline for that. So the month of May is the time period for appealing, and what we're thinking of doing with that is actually Dave's going to have a meeting with his board of review tomorrow. I think it's going to be via a conference call, but they're going to basically limit petitions that come in to have everything be done orally over the phone instead of in person. You got a box that you can check on your petition whether you want to submit everything written or if you want to do that orally, in person or by phone. So I think we're just better off just telling people do everything by phone. The plan was we already were talking about this several months back, especially after we had our last public hearing for our budgets at the West Campus.
I'm good, I got you.
So we were thinking about
Board
doing
wants
that.
more. I'm good. I think I understand where you're at.
Okay.
Unless the board wants more at this point.
Yeah.
Thank you very much. I think we're at a point where, with probably two things. Public access, and then there's another question related to employee access. And I don't want to keep going and mix those because time is of the essence. Where's the board at on public access? I'm at for sure limiting or closing public access to the courthouse and possibly allowance for 101 and or appointment only. That's where I'm at. And would like to move on. Where are you at?
I'd like to have Shane's input into how to make that happen. I'm okay, asking people why they're here, whether they need to be here. But it's gonna take, that's a difference for our staff, for our security staff to deal with.
Okay, yeah, before we solve things, I'm just trying to get direction from my colleagues. And so,
Okay.
you know, otherwise you go into a lot of scenarios and you don't have direction. And I'd prefer if you're at a point where we can do direction, let's provide that to staff. If not, and we need to talk more about it, then we will. But I've heard enough to know we should limit restriction to the courthouse, whether you call it closed or limited access or appointment by only, that's where I'm at. And that's the direction I'd like to give to our stakeholders that can execute that. Is that where you're at, or do you want more conversation?
Well, I think every department head is gonna want to address their particular circumstances with us. And what we do here does have impact countywide as well for the West Campus, for equity. But I'm not interested in closing. I am interested in appropriately reducing and limiting public access to some departments as departments can make that happen. Clearly, security is a key piece as to how you're gonna limit access to to the entire building. So, you know, that's the first piece. It's like, what's the plan? So we have consensus that we want,
Unlimited.
that we want the way to change.
Good, so we have consensus on limited, so that's good. So then maybe we can give the directives
But
that,
I also
how can we
want-
go about going
I
limited?
would like to know if we have consensus about also putting in place plans to make sure people know that we're thinking about the fact that they do want to have access and that they might need that. So
Absolutely.
it's one and two, it isn't one and we're done.
Absolutely, I absolutely agree. Yeah, this first thing is direction, and then we have smart, intelligent people to then change course and provide public communication to the public on what the changes are. So I know that's coming, but I would like to get direction and establish a firm direction from the board soon, then have the group execute those plans.
Well, let me start.
Versus just keep circling around.
Let me start with one possibly extreme. Is there anybody on the board that wants to just continue unfettered access to the courthouse?
No.
I don't think so.
Okay, me neither. So,
Is there anyone who wants to close it completely and employee access only?
Yes, I'm at that position with emergency court access only. So yes, I'm there, but I know my colleagues aren't, so that's fine. We don't need to spend much time.
I'm not there, so.
No problem.
So
That's off the table.
Well, I
I'm
think
good.
we've eliminated the two
Right, but
outliers.
But I would like to let the department heads say, they need to come back with a solution for every department, and elected officials, I'm glad you asked, Treasurer Stearman, we need to hear from you too. We are looking at reducing and limiting public access, and I would say in a significant way.
Yeah, it's not a new
But
thing.
they have to find the answer to each of their departments.
But what if they don't?
Well, that's what Shane's here for, right?
No, but I mean, what if we have a department head, what if we have a department head or elected official that says, just hypothetically, I got 8,000 people coming in and I'm letting them come in.
That's why we're here to set
Right. We're gonna
here
work
to
with
set
them
the
to get a
direction.
procedure
That's what
that-
I'm asking the group
Right.
to do, is set the
Okay.
direction. I think
But-
we're unlimiting,
Right.
and so maybe we can, if we agree, we can say, okay, there's consensus on limiting access to the courthouse. Maybe this group now can do it and execute and come back with that plan. When do you want to start it? Do you want to start that tomorrow morning, the limited? When's the timing
We
you
have
want
to
to
be
start it?
ready to do that, and I don't have a problem if we can fix the entrance piece and we can get that to make sense. Each department can begin to take their own, you know best.
Right.
We haven't gotten
want-
to whether or not employees should work from home due to HR reasons or health reasons. I mean, there's all kinds of things that department heads need to know you need to screen for that too.
Right. I don't want our security staff, Shane, this is pertaining to you and Sheriff Kennedy and Chief Deputy Renaker, to have an O'Hare Airport type situation, where they're saying, hey, only, you gotta have a good reason, here's the reasons, and we got 500 people backed up that wanna get in. We need to get, I think,
Which is why we need to close
So, no,
Back to my
I
point.
think we need to get word out.
What do you think?
I think we need to get word out.
I mean, you do this.
What's been discussed, I think what we were just saying is it's feasible, what they've talked about is opening the two front doors, locking the inside doors, I think they said opening the front doors, locking those inside doors. If each department, or we get one massive sign that says, if you need this department, call here, this department, call here, this department is closed to public, this one's,
Here.
if you have an emergency, call this number, if it's the clerk's office for a committal, at that point, they can notify us, or I can still have somebody downstairs. We will vet that person, or they can come down, meet that person, say, hey, no, we need them to come in. We can screen that person, bring them in, if we need to ask them the 3 questions and get a thermometer and check them, and I mean, we'll work with what needs to be worked.
Do you need revision to your budget?
Well, maybe see if we have, he made a statement. Do we have consensus on
Sheriff
that? I would
needs
support that.
$25 million.
I would support what Officer Bockenstead just mentioned, Deputy Sheriff. Would you? I support that limited access that he just described. Do we have consensus on that?
We have in general consensus, but we need to also have the details.
I know, we did, but that's, okay, good, so we've
So,
got
I mean,
that.
you
Yes.
know-
Do we need a motion? Do you want to get a motion, or we have consensus? Okay, so we have consensus to move forward with limited access. This group can figure it out. When you get us 3 involved in here and we go back and forth, it will take a lot longer. I would advise the board to allow the group of stakeholders, obviously we've got elected officials, we've got department heads, we've got security. Work on that and implement it. And then we have to communicate it to the public.
Through the website, I don't know where we are.
Through
now with
everywhere.
that.
Shane, what's a
Needs to-
reasonable amount of
HSU.
time for you to report back? Do we have our next meeting scheduled?
Not yet,
You want to do that today?
So let's talk about timing. So we have consensus on the timing. Do you want to implement it next month or tomorrow?
Not next month.
Okay, what day?
I would say after we get the report back. So I'd say if we can schedule a meeting for Wednesday, if you can have a report for us by Wednesday. I know that's ambitious, but this is, just looking at where we were Friday and where we're at today, we can't say we'll get to this in a couple weeks.
What kind of report are you looking for?
Just some.
You need direction from every department head on who they're wanting to allow access to. If one department wants to shut
Right.
down, then we don't need anybody to come in. If one department is saying, the courts are saying only emergency committals,
And
we
then,
need to put it all together.
and then the logistics of enforcing,
So
social spacing.
Until that time then, we're open for business, normal operations. Is that what you're saying?
I would say till Wednesday.
I think that's a mistake. But I would implement this I would
We could
do it
be open
tomorrow.
from,
I would
10 to
implement that
2.
process tomorrow and work through and educating the public and working through the process. I know
We
it's
can
not
make it
clean,
be
I know
known.
it's not perfect, but we're not in a clean and perfect time. We're in a time to act to make the public safe, and we're hearing from our public health director, we're hearing from other professionals, we're seeing it throughout the United States. I believe we need to act. But I will defer to you two, because I'm on one side.
Acting. It isn't the action you wish to have, but we
Correct.
are acting.
You're gonna act on Thursday. Sounds good.
We are, I think John's probably executing in the next 10
I
minutes.
have.
That's fine. You're an elected
Wait.
official. Go do it.
Are you aware of, Shane, are you aware of the recommendations, and will you be able to enforce those? And do
We
you
would have
need?
to have guidelines and direction as to what we're supposed to do from each department. If you're wanting to close that down, we would need some direction of who we're allowing in. I can't just make a judgment call.
Okay.
I don't know what the treasurer wants or the recorder wants, so we would have to have those determinations. We will screen or do whatever is needed and let those in that we're supposed to allow in, but we need direction as to who, so I can pass it along to the guys that are working there and myself, whoever's gonna be here.
So the departments have been thinking about this. I've been talking to the departments for 2 weeks. Like Eric Stearman said, he's already sent me a list of in-person. You've heard Jenny from elections, she needs it for these. That can be put together very quickly. Departments have been talking about that, have been thinking that through, have been asking for resources.
What would be your estimation of time frame then? 2 weeks, tomorrow, what?
Tomorrow at
Thank you,
latest.
tomorrow. So I'm with you on tomorrow.
So why don't we meet, let's have a timeline that it's due to you to send to us by 3:30 tomorrow. That should be doable, something in writing to you. And then we can convene on Wednesday morning, and it will be in effect by immediately on Wednesday. People know it's coming, it has to have some time to come out, people roll it out, Shane knows what to say, and it's,
So I
We're
just
ready to
want to
go.
throw out there, I understand the limited court access, I think that makes a lot of sense, okay? But I don't think it's the responsibility of our courthouse security officers to determine who should get in and who shouldn't. It's the responsibility of the department head that they're going to see. So if somebody needs to go see Eric, and all they need to do is pay their taxes, and Eric says, no, they can put this money in this drop box, that shouldn't be up to my security guys to fight that battle. That should be up to Eric's people to come out and fight that battle with the person. So it's great that you guys are coming up with criteria for entry, but I think each individual department head, if a department head says no entry, I don't need to see anybody, fine, we can handle that. But people that have specific criteria for entry, we're not dealing with that.
Would it be easier for you if we closed the courthouse to public access?
Well, that would be obviously the simplest thing.
I agree.
But Dawn, you can make that be known when you send it out for department heads, that the responsibility of actually meeting and greeting a member of the public will be on the department.
Sheriff Kennedy, do you have a recommendation related to courthouse access?
I would say, for the time being, limited access is fine. We don't have a confirmed case in this county yet. We don't have a confirmed case within 50 miles of here yet. So I don't think that we need to take that step. Now, if we get a confirmed case in Dubuque County, if we get a confirmed case in Clayton or Delaware or Jones or Jackson, okay, I can see that. But as of right now, the closest confirmed case is 50 miles or more away. So that's my take on it. Let's limit access. Yes, I think that's a smart thing. Completely closing things down, I don't think we're there yet.
All right. So I heard what you said on Tuesday at 3:30. If that's where you guys are at for consensus, I'm supporting it. Let's go. Let's act. Let's act.
That's where plans will be submitted to us, but we do have to have a new thing, I think you're correct on, the sheriff, which is to say that those department heads who make changes requesting that public access to their office be limited, they're gonna be responsible for screening the member of the public that's present.
So-
And then put that back on them, they'll have to.
Generally speaking, Tuesday plans in place by Tuesday, 3:30. We tentatively plan for limited access Wednesday at noon. And we meet on Wednesday morning and accept those plans. Is that what we're talking about? Is that the direction you want to give to the group?
That's reasonable.
Okay. You guys understand what we're trying to accomplish?
Do we have
Plans,
nodding
department
heads
heads,
from department
3:30
heads?
on Tuesday. We're tentatively planning limited access starting noon on Wednesday. We'll be meeting in session on Wednesday morning to confirm that. That's the plan for the courthouse.
We also have to talk about the plan.
We got
for
we got other places too. We need to move.
Our experts in the
So
courthouse will
thank you.
figure this out.
Thank
and
you
come
very
back
much.
to us.
All right,
I know
Chair,
that
what do you want to do?
West
engineering is here,
Campus.
we should be talking about
West
other
Oh, I know,
things.
I want to get to those other items,
Yeah.
but
Okay, so Tammy Henry, zoning department. So for our department, we did some conversation about it this morning, just trying to figure out what we could do. Most of our stuff is non-emergency services. So, they're important to people, but they're not emergency services. So the way our department's set up, if the West Campus, and I know this has to deal with the health department, if the West Campus locked its doors, we have a 3-person department, and we could do a lot of our things either
In the
per
lobby?
phone call and mailings for people, and accomplish what we need to accomplish for a temporary time period. I don't know how, Patrice, if you would, how that's gonna affect your department, health department in and out if we lock the front doors to the West Campus.
maybe we can jump to the quick. It's your building, your Department of Health. What's your recommendation on your building and your
And I
facility?
do need to speak that the other thing that we have is like tomorrow evening, we have a zoning board of adjustment, or zoning board meeting tomorrow night. That was a public record meeting sent out. So the way that I'm planning on handling that is I'm working with Nathan to do very limited, maybe there's gonna be maybe 4 board members there and no public in, and we'll go ahead and still carry those cases through.
Thank you.
And I agree with Tammy, the majority of our work can be done at home. We're already working with IT to get laptops, we don't have that. The only concern that we really truly had that we weren't able to come through a procedure is our public system water has to be done on a monthly basis. So we can contact those people and ask them to bring it in on a certain day. And I'm honestly going to be here every day, so it's not going to affect me, it'll affect Bailey and
So do you have
Colin.
an opinion on the West Campus related to its access to the
We
public?
can-
Limited, closed, open? You're the whole building. You're in charge of health for the county.
Please,
The whole-
Supervisor Wickham, she wants to answer the question.
Well, I don't know about the roads. I don't know if they can operate, and I don't know about the county assessor. But I do know ours, we can work per home.
So
with computers.
you're okay with the outside door being locked and?
I am.
Okay.
Because the majority of our work is.
I think that's.
So
what we're
that would
trying
be
to
limited
establish.
then?
Yeah, it would be
Okay,
limited.
you're talking about limited. Okay, good,
And
thank
call
you.
us.
I wasn't
We all have
recommending
phones.
the staff not be in our office, I was recommending that we don't have the public walking in.
Yeah.
Our office is set up with 2 doors, I mean, we could work as a staff in
Inside,
both remotely or internally.
Thank you.
And we could as well, because we would have that 6 feet.
I think
And maybe
we'd
that, okay.
like to have, after we hear from Russell, and then, Troy, did you speak for Dave Kubik? Well, you mentioned him.
That's fine. Let's keep moving.
No, I want to hear if he's talked to Dave and. Remotely, right?
Walk in the house and not touch anything at all, like let the homeowner open the doors and do all of that. I believe they could do most of their work from home or talking, if that is the case. I guess in their office.
I thought on Saturday at the Farm Bureau Forum at Balltown, he indicated he was calling those people off. They were not.
He was calling them off from going out doing any more work, but those already scheduled appointments, there was an appointment scheduled, let's say, right now, they were still gonna honor those.
Alright. Russell?
Russell, secondary,
Anthony, talking on behalf of Anthony, but I think we would recommend closing the doors to the public, but still accessing work in the building itself.
Thank you for being very clear and concise. I greatly appreciate that.
All right.
Speak my language.
Is there any reason for the West Campus to wait to do that? It sounds like there's consensus. Is there any reason we can't lock the door starting tomorrow morning?
Give limited access is what you're talking about.
Limited access.
Appointment only.
Yeah, so Tammy, if somebody shows up, they call you, they're standing out there, they call you, you send somebody out, you can.
Limited access. So the statement to the public is limited or closed, West Campus?
It's limited to appointment only. So again.
I need terms for the public. I think limited.
I wanna hear from them.
Well, yes, I'm asking a question. What's limited or access?
Closed,
Limited or closed?
or open by appointment.
I would say that we could, in our department.
Are you saying open by appointment? Suggesting close to the public for Anthony? Yeah, so then that's what I
Of
would
course.
recommend for the zoning as well.
What would you recommend?
Closed for the public.
I
You
disagree.
with that?
It doesn't need to be closed. It can be limited to appointment only. It's the same effect for your folks.
But
It's
and
the
we
same
don't-
effect.
I'm with you on
How are we
that.
gonna screen those people?
Let's
How
just
are we
get the
gonna
opinions and then the board can make the
There's gonna be a
decision.
sign on the door with the drop box that says, if you need to schedule this office is currently with limited access to public. Please call and make an appointment to schedule a time to visit.
And you determine if that's the purpose.
And that would work for all of our departments, I would say.
Patrice?
That would be fine.
Do you have language related to appointment by only, limited or closed facilities? Facilities. Do you have recommendation for the Board of Supervisors on term? And what is that? What is agreed? And what is it? I don't know what we're agreeing on.
I agree with Tammy. If Tammy is saying that if we have to do it by an appointment, we could.
So the message to the public on Dubuque West Campus is by appointment only.
Right.
So we could say limited access by appointment only? Is that where we're at?
As well for the engineering and health
Okay.
and zoning.
Fair enough.
And
You got
I
it.
can't speak for the assessors, but I would assume that would work for them as well.
And
Okay.
then
So that's good.
You'll work out the details, some kind of a
Yep.
sign if
Yep.
somebody shows up
And
and they call.
When
Yeah,
would you
all the
like,
numbers.
when would you like that to occur?
We can make
Wednesday at
that
noon,
effective-
or
We can make it effective, as of tomorrow. We can work something out.
I'm comfortable with that?
Close of business tomorrow?
Yep,
Well, what is it?
By the close of business tomorrow?
yeah.
By
So then
4:30
effective,
tomorrow?
make it effective as Wednesday morning. We will get all the details worked out tomorrow.
All right.
Okay.
And I will have to rework what I have to do for the public meeting tomorrow night.
I agree with that.
All right.
I'll move.
I think.
We have consensus?
We have consensus. I'd like to, whatever time that we meet Wednesday, have somebody from the West Campus come in and give a final report. Final's probably not the right word because this thing is moving
All
and,
right. What about Conservation Swiss Valley? Conservation Swiss Valley, do we have any opinions related to that? Do you want, does the board want to address that? Related facilities?
My conversation with Brian was, he was leaning toward closing it this morning.
Okay. Board, what's your thought? I would recommend closing the inside of Swiss Valley. That's where I would be at. That would be my position.
yeah,
But he was saying that he's gonna hold board meetings and that they're open to the public. So I'm not sure what the message is from
It would probably
conservation.
be call in. That was a couple days ago.
Well, and one
So-
of our things for,
Opinion probably changed, just like our.
meeting schedules, I would like to talk if you want to make a recommendation for your boards and commissions.
Correct, I would like
They
to
would
get to
like
that
some
too.
guidance if you
Right.
would like them to postpone it, try electronic, encourage them to do it other ways.
It's hard to send a message for conservation because obviously no one's gonna be thrown off the property if they decide to use a trail. So it's really about whether or
Building
not there's
only.
access.
Building only, as I'm referring to. All the parks, I would strongly advocate they remain open. That's exactly, the parks and the physical spaces remain open. Let me rephrase that, the parks and the land would stay open. The Swiss Valley Nature Center, I would propose to close that to the public, starting
Close
noon
of business
tomorrow.
tomorrow.
We have, Brian Preston, who would like to be patched in if you have a minute.
Oh, fantastic.
Yeah, of course. When is your next conservation board meeting? Supervisor
It's
Wickham.
Thursday. I think this Thursday, I believe.
Are they making remote plans?
His plan was right here, and about be remote, be on Skype, and
Okay.
his plan on Friday was to have limited have access to the public and social distancing, but that's changed. So any public meetings, we would have a call in.
Brian?
Yep.
Yep, you're on speaker.
Awesome. Thank you.
Plan on Friday was to.
Okay, Brian, we're talking about, what your plan is for, or recommendation for public access to the Swiss Valley, Nature Center.
Yep. So we already took the step. We closed the Swiss Valley Nature Center to the public, so it's for staff only at this point. I just want to pass by that what I thought would happen did happen today, that with people off work and out of school, we have seen an uptick in use of our open spaces, especially today already. So I would highly recommend that we keep our parks and trails open. We won't be open pavilion facilities and stuff for the foreseeable future here, but that's my recommendation.
I would support that recommendation in the comments you made.
I support it as well.
I do as well.
We have consensus. Thank you, Brian.
Thank you.
Thanks, Brian.
Bye.
Another efficient department head.
All right.
Do we have any other facilities we need to talk about?
Sunnycrest, that's already on lockdown, right?
I think I'm okay with Sunnycrest and what they've done. I don't need to discuss any of Sunnycrest myself. No,
How about the library?
The library is currently closed to the public. It was
Okay.
I just saw it in the paper today, so I know Michael is listening
I
to it.
communicated with Michael this morning.
I support that. Didn't know it, but I support that.
No, the programming is closed, sorry. It's open to the public. The programming has been canceled.
Michael said thank you for remembering him, because
Tom,
sometimes.
we have our
it
board
gets
chair
overlooked.
right here. Sorry, we have the board chair.
Yeah, the library's open. The programming has been canceled.
Okay.
So their programs.
What,
Right, we might have a recommendation for that.
Yeah.
I would like to have Michael be engaged in conversation with us if we have any direction over that. And, it's arguable that we don't have any direction over that, right? Because it's a separate standing entity.
But there's numerous entities. Okay,
Do we have a strong recommendation for them to
I would,
follow the county?
I think we would take your recommendation on our Wednesday meeting and go from there. And so it sounds like you have a plan of action, and we're 2 days out, which I don't love, but it's, at least it's a direct answer, so
Well,
thank you. Thank you. And my recommendation would be to close,
and there's,
my personal recommendation.
there's the potential for an influx of people because of schools being closed, so. Okay, we'll hopefully then have Michael at the Wednesday meeting as well, which I think leads, okay, thanks, Tom. Leads us, I believe, to our next, well, we've got budget and purchasing.
So are we done with facilities? I sometimes think of all these sheds and everything else, but,
Emergency management, do we have any control over that building?
oh
Or
yeah.
is that typically
But,
close to the public?
I would assume I would delegate command and control of that building to Tom Berger. Is that what the board would like to do? Tom Berger would have command and control of that building, along with his.
Yeah, and I think Tom's well aware of the social spacing
So
and.
it would remain open to the public in regards of EMS and other elected officials and professionals.
It's typically
what I would
not open to the public unless there's a meeting. And I'm assuming that they are exercising remote. I know the Dubuque County Firefighters Association, even though it wasn't there, it's canceled for tomorrow night, which is a good move. So I'm assuming that that's where they're all heading, so.
We have a hydrology board meeting coming up that we should maybe just, odd thought there, but, I did have another thought too. I feel the auditor's office is an unknown. We are restricting access and limiting access to the public to the courthouse. But we don't have an elected official present to tell us or to maybe give us a recommendation for tomorrow. Will you be able to be in contact with Denise?
She's been in contact by email, so yeah, I'll reach out to her by phone.
So you'll be able to
also.
work through all of that
Yeah.
with her, Jenny?
We've
and
heard
us?
from Jenny and
And then Jenny and
Megan.
Megan.
We have two people, Jenny and Megan are both here, so I'm comfortable with that. Can we circle back to EOC? Are we okay with that? Just being Tom Berger?
She's in charge?
Sure.
Okay, yeah.
I'm comfortable with that. It sounds like a sitcom. A bad one from the 70s. Okay, do we have any other facilities that we're missing? So Supervisor McDonough, that was good,
Well, we
good
have
to bring that one
Sheriff
up.
Kennedy. But that being said, Sheriff Kennedy, are there any remote things that can be done from your office to limit the number of people coming in? I'm assuming you've looked at it.
Those people, you've already closed visitors, but go ahead. You can remind us what you did on Friday.
We have, just gun permits, you know, people can do that online. We're gonna, blast something out on Facebook telling people that, you know, anytime they need, civil papers, that can be accessed, via online. We're just gonna kind of direct people that way, but, as far as our window, I mean, our window will be open. We have to be open, in case public needs something, so.
What about visitation?
Our visitation is not face-to-face, it's over, people come in the first floor and they check in, it's through video monitoring, so that's not an issue.
Correct, but still, visitation, do you wish to have people come into the building for visitation
They can still come in for visitation at this time, yeah.
at this time? Okay,
So
so that may
we're
change as
actually
well.
Having a meeting whenever this wraps up, so, to discuss that, so.
Thank you.
Thank you.
So when we referring to the courthouse, are we saying, oh, jail as well? Well, because I have not talked to Randy Renison about his services.
I would say it's a little different because it's beyond our security, so it's a good point. I hadn't thought of it.
No, I hadn't.
So, I would include him in the discussions and have him report back to us on Wednesday morning as well.
Okay.
For a tentative decision at that meeting.
Nathan as well.
You let him know where we are.
And Nathan, yeah, I
what
guess
consensus
Nathan's
looks like, then he can determine from there.
Yep.
And I don't know if the judge and the clerk of court, if you have a clear perspective of what we intend to do in the timeline. I know that Judge Schubert, you've been in and out. Did you have any need for clarity from us? Jonna, did you want to come up too to hear? Come up then.
I think Supervisor McDonough wants to make sure that you're aware of what our limiting access by appointment or having security. They're going to work out the details. They're going to come back Wednesday and give us a
Wednesday
report.
noon.
Wednesday morning.
Wednesday noon, we're tentatively planning to limit access to the courthouse.
Right, and I know that Judge Lekar is following what we're doing, and we've talked about having a meeting very early tomorrow. You're looking for a report from us.
3:30 tomorrow.
3:30 tomorrow, we will have it ready for you. And I guess just so I understand, I mean, and I don't know that we do this is just something we have to discuss, but, I mean, if we had, say, a hearing that we wanted to do with limited parties, are you saying that it would be an option for us just to have the parties, the two attorneys, without having more than 10 people in the space?
Yes.
To come in and hold that
That's my
hearing?
understanding. They'd be met, escorted at the front, and you'd have that limited access to the courthouse. So
Okay.
yes, that's
All right.
my scenario.
Well, let us, we will have our meeting early. We will have a report in front of you at 3:30 tomorrow.
Okay, wonderful.
I appreciate, your letting us know what you're thinking.
Thank you. Thank you. Thank you, Judge. That all our facilities.
Did we forget
Thanks for
anybody
picking
else?
up the old jail. It's attached.
I did include them on my email this morning. So
Well, I assume,
Human Resources is a department.
well, I'm thinking buildings, you know,
Discussed operations, my department.
Good with
Yep.
what we're proposing for
Equipment,
limited
yes.
purpose.
Yep. I will provide my list as well with that.
how about I'll need a motion to recess for 5 minutes if we're going to the next topic.
Okay, there's a motion to recess for 5
Second.
minutes. Second. All in favor?
Aye.
Aye. 5 minutes. I need to get up too. 10 PM or 14 or 12.
Right, we're dwindling it down.
All right, on the agenda, next up, I believe, is budget and purchasing.
We do have some personnel B. We
Would you like
have
to
not-
address those?
Oh, personnel and policy implications.
So, can I just start out, because I think mine is with the sheriff as well.
Sure.
So I've had conversations with all the department heads. There are a couple scenarios that I would like you to consider and provide direction. One of them, as we're limiting the public access to buildings, there is potential where the workload would decrease because maybe the registrations are not coming in. You also have heard from other elected officials that they would be maybe working an A team and a B team, so they would not always be here at the same time. So there's consideration that there may not be the 40 hours of work during the work week for the employees. So the question has been directed is, do we require them to use personal time? Would we allow them to use sick leave? Would we just provide paid leave without taking any of their accrued leave because it's at no fault of their own? So those are the questions that I would like to pose to you. My recommendation would be to a paid leave status. It is at no fault of the employees that the work is limited. I do believe that would be on a limited basis. You know, there's still work to be done. I would not see my staff doing it a whole lot. Payroll still has to be done. But the elected officials and department heads are gonna have to decide what they need their schedules to be. But we have been getting a lot of questions of that. Also with childcare, that is another one I had just this morning. Next week, my children go back to school. I do not have alternative plans for that. Can I use my sick time? My direction to them right now is no, that is not how the admin policy or the contract reads, but that would only be changed at the direction of the Board of Supervisors.
So maybe the first recommendation you had was paid leave related to shortage of work and if they're working at home, and that recommendation to move to that, I would support that.
Okay.
The
For
paid,
anything with a
the
reduced
paid
schedule.
leave, a couple other scenarios we can work through, but your first one related to employees, I don't, it's a short-term period. As you mentioned, it's no fault of their own. County's making decisions. I would would want to keep the payroll process identical
It's protecting the employee's income during this time.
and protecting their availability to the county.
Correct.
We need them.
Yep.
If not today, for many years to come.
Okay.
And we might have a couple variables in there too. So let's start with permanent full-time. Okay, that caveat.
Yep.
We might have a part-time caveat too. So in your recommendation, full-time, permanent full-time positions?
Correct.
Okay, I would recommend the paid leave and follow your recommendation.
When you say paid leave, are you talking about from their vacation or PTO?
No, just paid, normal pay period, 40 hours a week, their normal process, their normal hours, whether they're hourly or salary, that amount at 40 hours.
Okay.
Obviously, if they're working more, then it's not an issue. It's
Correct.
not the problem we're discussing.
Okay, but what if it's a combination of work but not being there, and then a combination of perhaps an overtime day?
I would follow whatever normal,
It would
either
be
union or
hours worked, so if they worked 3 days and then.
total in
yeah,
one work pay period, right?
It'd be work pay, yeah. It's
Is it a
only
week or a
hours
2
worked.
week pay period?
It's a 1 week, it's 40 hours
1
for
week.
most of them.
Okay.
Suncrest and the sheriff's department are a little bit different, but I don't.
So
think
obviously, if
that's
they
what
work
said.
more than 40 hours, they might have overtime provisions, or they're exempt. If they work under is the scenario we're discussing, I would follow your recommendation that we just have paid leave and they're paid the same dollar amount at this moment.
Okay,
No
and my
change.
question was, I don't know if you understood it,
And I probably did.
it would have been a combination of pay for not working, but it goes over 40 hours. So 20 hours, let me make it real clear. 20 hours of pay even though they weren't required to work. But then they worked 24 hours.
So if they work, no, they would work
only
24
get
hours
paid
and
for
then they
40.
would get 16 of
It would be
paid leave.
capped at 40?
Yes, yes, if they're
Okay.
not working more than 40.
So I asked the
Correct.
question.
Yep.
Well,
I understand what you're saying, yep.
okay.
Good question. Good
No.
clarification. Okay, so how do you feel?
I would like to see an emergency policy developed by you. I think you know some of the things that we have consensus around, that employees will be made whole and that that's gonna be our obligation to them. And it's not anything that's within their control, and we wanna be supportive of them and stand with them. I think that's what it's in our budget. We've levied the taxes, collected the taxes, and that's what we owe to our employees. And I think you can put that into a plan for us to see. I would like it titled some kind of emergency policy, not a policy that comes in a snowstorm, and not a policy, it is an extraordinary emergency that we hope never duplicates itself in our lifetimes. So, and I think it needs to be framed that way, that it's a COVID-19 policy, to be that specific, a pandemic policy, so that it isn't used as criteria for another board another time. I think that that's a good way to protect, what we want to do and be right with our employees, and I think a moral obligation as well, and also taxpayer interest, that we didn't just create a new thing, it's specific to these beyond any precedent matters. And I think inside that, you can create something. I have no problem assisting people to stay home if they have a childcare emergency. I want them to do that. So inside that, how you think that's best activated, I would like to see that be done. Can you draft that for me without taking me through every scenario?
Yes.
Dawn, any thought on implementation? How soon? Can that be something we talk about Wednesday?
Yes, I think you would need to do it in tandem with your limited access.
You'll have a recommendation for us?
Yes.
Okay. So that sounds like we have consensus. Okay.
You had a very specific one about childcare, is that correct?
So if, by contract, my employees cannot take sick time for childcare purposes. And so the question came up, if they can't take sick time, are they allowed admin time, because the federal government is recommending that employers allow people time off for childcare.
I would refer you to that this is a different policy. It's a COVID-19 policy. And we want our employees and their families to be in best position. Now, if you would tell me that that causes a ripple effect and 40% of your workforce is going to evaporate, and that causes some kind of an extraordinary emergency inside your department, then I would just say, well, what are you going to do about that, Sheriff Kennedy? What recommendation do you have? You know, I think our officials and our department heads have great empathy and have relationships that are well-grounded and respected with their employees. So I'm looking for you to answer that, and I'll just agree.
So can I, one thing with maybe that affects Sheriff Kennedy's is it's really those departments identifying the essential staff that they need.
Correct.
Because some of our staff here are very customer facing, and a lot of their responsibilities are that way, and if we reduce that, they may not, the necessity of having them on site may be different than someone who's working in the jail. So a policy can be written, but it's going to have different caveats, because it's not necessarily going to be a one-size-fits-all, because,
course not.
yeah, like
Of course
Sunnycrest
not.
is an
It's-
example as well.
depends upon the
Yeah.
position.
Yeah.
So would Sheriff Kennedy, do you think you'd be able to identify the variables and get with Dawn and?
Yeah, I mean, I can identify a few. Obviously, we're not gonna be able to find a catch-all for every single scenario.
Most likely, we're talking about a temporary policy of 1 to 2 months, hopefully. Right?
Yeah, and I don't know exactly the employee that he's referring to, but if it's somebody who's doing more of office work, is it something that they can work remotely? Again, that's gonna be different than someone who's working in the jail. So it's almost a case by case, how essential is it that they're here in the building, how essential is that work gets complete in that time?
Can you and Dawn work together to create the discretion inside the policy as it relates to law enforcement, which is a different level of need? We're not restricting or reducing anything with the public.
Right, no, I understand that. Yeah, I can get with Dawn tomorrow and we can.
And I think, I mean, it sounds like you're thinking of a couple scenarios that might not work out so well. I think that's a departmental thing. And I don't think the language should be any different for Sheriff Kennedy's department than for Recorder Murphy's department. They're the experts in their own department. I think we come up with good language that.
Them to identify the essential functions.
Intentionally broad, but gives discretion to the elected official in Sheriff Kennedy's case or the department head.
Well, and just, the biggest concern obviously was being language in a contract. We understand, I know you know about setting precedents and what that can cause down the road, so that's, but if we're gonna do policy on that, then I think that's.
I would suggest then, if we have an issue of setting precedents, that we send a letter to the unions, having them sign that this is non-precedent setting and only for this particular emergency, because I've signed numerous of those over the years.
Yep.
Okay, I'd be satisfied with that. So.
Okay.
Would agree.
So I will have a policy recommendation that deals with those and some other sick time, use of sick time for family members, those types, quarantine. I'll identify all of those in there for you.
Do we have any contract employees that we need to be concerned about, or hourly employees? Because I would like those folks to also be maintained and made whole.
Hourly employees?
Or temporary, part-time, those types of things, probably you're talking about, part-time or
I would
temporary.
have what their regularly scheduled hours. Most of our part-time have regular hours.
Okay.
So I'll word it as what their normal
I
work
just
schedule
want to make sure that
would
we're
be.
thinking of all the levels of our
Absolutely.
employees.
Yep.
Okay. Are there any other specific issues, Dawn?
I do not for that one.
Okay. All right. We have next up budget and purchasing.
Stella and I were talking about this morning. I know you've moved on some budget allocations, but our discussion was recommending that you add another account for just COVID-19 expenses. I know a facility superintendent is, looking, depending on the access to the buildings now, but adding some additional staff, to do some cleaning during regular hours. So there are little expenses here and there that we would like to have, access, that every department would have access to that. And I don't know if we really threw down a number.
My initial thought was 500,000, but that was before you, had approved some monies for health department and, emergency management. My thought was to put, a line item in our capital projects department, so then it would be available for all departmental use and have a number in there, and then it's easily tracked as to what we're spending. Because this has been declared a federal emergency, there may be funding
Should be.
at some point, so we want to track as best as we can, what we are spending, on
Absolutely.
this.
What, do you have a capital number that you would think that you have? 250,000?
Yeah, I think
Half
that would
million?
be, 250 would probably be good. What we would be looking at would be any kind of, additional costs because of this. So, computer equipment for people to work at home that we wouldn't,
If we could score 100 respirators?
right?
I think I don't want it to be that broad. I don't want it to be computers for people to work from home. I want to be engaged in that conversation as it goes on. I don't want it to be just blanketly that we're $250,000, it could be new technology. I'd like to see that unfold with more specific requests. I think it's very wise to have a separate account, and I'm liking that we're tracking, but I would like to see it be more reflective of where we are. I don't want to just give up oversight because we know that this is gonna be unprecedented areas. Sometimes it's nice to say we're being more responsive and watching the dollars more because it's unprecedented. People are gonna be nervous about lots of things. We had a boardroom full of childcare providers who were incredibly worried about their small businesses. So I'm not for blanket numbers. I'd like to see us bring it in and for a specific need. We're meeting, we're not inaccessible, so let's go slow.
My thought is I would do a real quick budget amendment. So we are meeting, next Monday on our, budget amendment public hearing and our, FY21 budget public hearing. So I would need to turn around quickly here, and I do need a kind of a bucket number to put in there because it does take time to amend the budget. We
And you
can't
have
just
two
turn around.
things, you still can have a bucket number and still follow processes
Yes.
of purchasing and, you know,
So-
whether it's approval process, those
Yes.
are independent.
You will see the claims come through, as always.
I don't want to see the claims come through. I understand, I want to see the claims come through, they're piled. But what I want to see is authorization before the funds are spent. I want to have some accountability that way. And I sound like that doesn't happen. It does happen usually.
We can set up some more specific approval process of how to access that funding.
And I guess I'm okay having those discussions in our future meetings, but I would take your recommendation today of appropriating, budgeting, $250,000, you're talking about for fiscal year 21?
In
20,
fiscal year 20,
excuse me,
so
fiscal 20.
amended in to be accessed.
Yeah.
What purpose? We just gave $500,000 to the health department, right?
For other departmental access, so we know other departments will have some needs.
If Sunnycrest needs more masks, if there's
Sunnycrest.
something that's
If
beyond
they need,
their
if they
normal
need
course of operation.
trailers for 24/7, 365
Right.
coverage.
I have another, if I could.
Go ahead.
One other issue to consider is if, once we get past May 31st, there is no option to do a budget amendment during the month of June. So I want to make sure that your request, you feel is enough to get through at least to the end of the fiscal year. That's my only question.
Yeah.
We
Tell us
may
how
be-
this is all gonna play out, Stella.
Well, we may,
Well,
alright.
I'm teasing, I know.
My point is, in the month of June, we can't do a budget amendment.
I'm with you.
I don't like the big numbers coming in. I know it's unprecedented, and I know I don't get to make it be not expensive. It's traumatic. But we are handing out today money greater than what people are asking for. That
We're
concerns
allocating.
me.
That's our leadership. That's leadership, and I think that's exactly where we're at today.
And so that's why you're hearing me say I would like to go slow. We
It's,
can be responsive. We're gonna meet again. What is the need to put $250,000 into a new account
you ask
today?
Italy and China, what going
Again,
slow
I
will
don't-
get them. And that's not where I'm at.
Not in the crisis they are in because their county board of supervisors didn't make a right budget allocation. When are we needing to decide before could we find out what equipment needs we might need? Do you have anything? We're gonna be here Wednesday. Let's see what we can gather before we're together on Wednesday.
I will make a motion to have the budget director prepare a budget that puts $250,000 into a capital program for fiscal year '20.
Is there a second to the motion? I will second it. We're open for discussion. All in favor signify by saying aye.
Aye.
Aye. Opposed?
Nay.
Carried 2-1. Okay, any other budget and purchasing issues?
No, we'll be sending, a notice out to departments, because we'll track any hours worked toward it as well.
Yeah,
So we
everything.
have all of
Hours,
that.
operation, we should get up to 75% reimbursement. The federal funds will come and these will be eligible. We just need to track them.
That was gonna be my next question, is I forwarded that email on the Stafford Act. I'm sure everybody's aware of it, but, are you set up to track?
Yeah,
these?
Dawn and I had talked about that this morning. We're planning to track, and we're asking all department heads to track any expenditures related to COVID-19.
Does this would it include paid leave and that type of thing?
I think we would have
Throw it in there.
to-
We can put it in, right?
Yeah,
We'll
I
have
mean,
to have
it's,
that discussion, yep.
Yeah.
do our best to justify it later.
Yep.
Throw it all at them.
And to answer your question, Dave, we will have an opportunity to amend the budget one more time. I
That
think,
shooting range.
so
Right.
We'll be able to adjust as needed.
Okay. Thank you.
Maybe we
Okay.
can pay for courthouse repairs.
Next. Chris, you have anything under budget and purchasing? Yep. You'll have to come to the mic.
The one item that had come up is my current cleaning contracts. We have no idea what condition these people in there are coming and working after hours in any of our buildings. They could be losing a lung every night and we aren't gonna know it, and no matter how well they clean up after themselves, are they gonna get everything? So, I'm just trying to come up with options and possibly some recommendations as to what direction you want me to head.
I don't understand. What is your question for the board of supervisors as compared to the human resources person?
At this point in time, I would like serious consideration on being able to hire one more full-time custodian to be able to take over these contracts so we know we're getting everything clean. I'm having problems with them, and it's everything from paper towels not being put in, and the staff goes to use paper towels and they're empty, to other things along those lines along those lines in reference to.
I think that's a little beyond
Yeah.
the scope of this. I mean, we can
Yeah,
we've talked about
definitely
this,
need-
but I
yeah.
want to make sure, I think that may be beyond the scope of our agenda.
I think it's something that you can do.
Yeah.
If you two discuss that, I would be open to a proposal to adding that. I know that was your original recommendation, to have staff, and so I understand that. And if you feel there's inadequate or unknown standards related to cleaning, that's also a problem today.
We can
Chris,
bring
my-
that on the 23rd with numbers. We have numbers pulled for it.
I have talked to department heads and staff at the West Campus and the old jail. There's similar concerns, different faces on a weekly basis, turnover, and from Chris that he's spending a lot of time training people how to do the cleaning at our facilities, which to me should be the contractor's job. So that's telling me that I think, similar to some of the things we've done at Sunnycrest, doing it ourselves is probably better, especially in this day and age. So, I would look for some kind of a report. I agree, it's not necessarily part of this emergency.
Sounds like you got some consensus to
okay.
put some stuff together, get a recommendation to us. So thank you for doing that.
Reference to the other part of it, I should not have any problems. We've talked about it. None of my expenses are gonna be significant unless I have to do a major physical change to the building for traffic control internal to the building. So right now, we'll be fine, budget-wise.
Thank you. Stella, do you have something to add?
Yeah, I forgot to mention, Jenny had to leave, but she asked that we do put, 50,000 into her budget for more mailings, as needed, as she discussed.
For fiscal year 20 or 21? When's her mailings go out? Before, in July 1?
She was saying
With
for
the primaries, yeah, she was talking about in June.
They go out on June 2nd, so that'd be a thing.
Well,
I'll
the
make a
election
motion.
is June
What was
2nd,
the
right?
number?
50,000.
I'll make a motion to direct the budget director to put $50,000 in for an amendment for fiscal year 20 for the elections department.
Is there a second? I'll second it. There was a request from the elections commissioner.
Yes.
She asked me, but
Okay.
she had to leave.
Any discussion?
Could she
I
be
think-
here on Wednesday to give us details as to why that number is?
I will ask her.
Okay. Any
Discussion.
other discussion?
Yeah, I think, we're at a time where I need trust, I need loyalty, I need competency from our leaders at the county. And that's most everybody in this room and many that were here. You have that from me today, and how you've carried yourself and how you've done your job in my 5 years here, a little less. That's why these decisions for me are easier. We also have a policy, it's not use it or lose it. So no one's gonna rush out and buy something new they always wanted because we have COVID-19. I trust you. The community needs you. They need your leadership. They need your attentiveness to this. They need you healthy. So thank you, and I fully support these recommendations.
Are you speaking to Stella?
I'm speaking to the community.
Okay. Any other discussion on the motion? All in favor signify by saying aye.
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 Nay?
Carried 2-1. Okay. Any other budget and purchasing issues? Nathan?
I've been multitasking in the back room, so if I missed this, I apologize, but it sounded, you're on budget. So, as you may know, I am currently down one position. That applications came in last week. I will be starting that process. I am also probably going to lose my intern because he goes to Loris and they're sending everybody home. So my request would be if I may purchase some block hours from some of my vendors for engineering, for support. A few years ago, I was told that was not done by the county, and that's fine. But if I can purchase some, it's just way faster to get emergency help when needed if you have hours on account. They will not expire for 24 months, so they would not go to waste.
How much money are you asking?
I don't know. I just want to get past, I'm not allowed to right now per the board from a couple years ago, so I just.
I'd like to have you explore it and let us know on Wednesday. Let's see
Okay.
what we need.
Nathan, are you
support that.
talking about for the next 2 or 3 months?
Yeah, I mean, I'd buy like 80 hours of level 2
Okay.
tier support, and I would use them as needed over the next 3 months for sure, and then if there's any left over, I'll certainly use them.
Okay. I think if you give us a little more detail, I certainly don't have any objection to that.
Or do I?
Do you, specifically related to the IT budget, do you feel that the capital components, and this might be a question to Stella, covers Nathan's potential expenditures?
That was my thought.
Okay.
To have that bucket
I
there,
thought
and I thought a lot of, IT equipment would be the necessary stuff to keep operations going.
Okay, thank you.
This isn't the equipment, this is personnel time, correct?
Agreed, I was just circling back to make sure that your other needs were met.
Do you anticipate needing lots of new equipment?
Yeah, if we're talking.
Yeah, can you also tell us how this is gonna end?
We're not talking huge amounts of money. I mean, we're not talking hundreds of thousands, but I mean, yeah, I have already ordered a lot of laptops. I've already ordered a lot of wraps. I'm gonna be ordering some MFPs. I mean, the users need to work at home as efficiently as we can make them, and that's happening, I mean, quickly, so.
And
Thank you.
Stella, would things like laptops and scanners be stuff that we would track for potential reimbursement?
Oh, absolutely. It would all go into those accounts, and that's the account we would kind of track for any kind of reimbursement.
Okay, thank you. All right, thanks, Nathan.
Thanks, Nathan.
All right, any other departments with any other budget or purchasing questions, discussions? Then we'll move to meeting schedules. I'd like to start this one. I've had discussion via email with Chairman Tom Beshen and Patrice. As you know, the Board of Health has met typically every other month. We all know that they were already discussing having meetings more often. Both Tom and Patrice have indicated to me that a lot of the issues, as we're meeting twice a week, will be common. That why don't the Board of Health meet jointly with the Board of Supervisors? Tom, is that the discussion we had? I think it's a good idea. I'd like to hear from my counterparts on the board, Ann and Jay.
My first thought is I think at first blush that makes sense. But we have a lot of non-health things, if you just saw, that we need to take over as well. Now, maybe if we work for a whole 8 or 10 or 12 hours a day for the foreseeable future, we can solve those. But I would be afraid that many of the details related to the Board of Health, I wouldn't be able to provide value. And they may limit me from solving other things from the Board of Supervisors from other departments. And that's why I ponder. So that'd be my first thought. So I appreciate the invite. I just, maybe in context where we meet and we know we're just gonna meet for a half hour to get key updates, and then we disband and the board can meet on separate issues, that's where I would be at, Supervisor Baker. I just don't wanna get caught in a 2-hour Board of Health meeting that.
Typically though, if you think about even our regular meetings, we have our meeting, which has got a pretty good structure to it. But we have work sessions that are specific. So I'm thinking, what about scheduling a work session with the Board of Health?
I'm with that.
And then
Okay.
that can be their meeting as well.
I like that. I like that.
Okay.
Yeah, I like that. And Tom, you might have to go to the podium for Supervisor McDonough, Wickham, and Baker.
Our thought was that these meetings that would be joint with you would be special meetings for the Board of Health. We would still conduct our regular meetings to conduct the other part of the Board of Health business, the water management, the septic tanks. But this, we would join the supervisors specifically as it relates to COVID-19.
And just that, okay, that's helpful to give me a little more clarification. And I think if we schedule it for kind of like a work session and we have a allocation of time, I think that's helpful. It's good to communicate, but things are changing rapidly. We need to make decisions potentially rapidly like we are today.
Because I vision that if the meetings are Monday and Wednesday, something may come up that you're gonna want guidance from the Board of Health.
Yes.
We could have a special meeting between Monday and Wednesday and bring our recommendation back.
I'm comfortable with that.
So just start those Wednesday?
Yes.
Okay.
I would be open for that as well.
So, we haven't talked about our meeting time
Good to
for
get a
Wednesday.
good cadence too of whether it's Monday, Wednesday, if that's what we're open, and then just we kind of lay that out over the next 4 weeks and the times.
Helpful for department heads,
Exactly.
if they listen in to have a set schedule for the next couple of weeks.
Yeah, I agree. And I think we should go out about 4 weeks.
Yeah, okay, so does Monday, Wednesday work for the board?
Sure.
Yeah.
Everything else is canceled.
Yeah, yeah.
Not yet. I'm working on the
to-
casinos, not yet.
I would like to move this format to some other
Q's done?
format
Okay.
than we're sitting here like this. Nobody wants to sit here, nobody wants to be in this room. I've seen at least 12 inappropriate touches to the chair Stella's sitting at right now We had guests throw their gum away and then goo all over the podium. So, I mean, I think we need to get to a forum where we can be meeting without meeting like this.
The West Campus has a greater ability, technological ability to do more of a Zoom. Even if we do an electronic meeting, we do have to have a room where people can come in, the public can come in and listen.
Right.
So West Campus would be a better facility if
Right.
we want to allow, and I don't know.
Listen, are you-
With your Board of Health, if they.
It's right there.
Do
where
you
the
think
Board
our
of Health- that's
YouTube
where-
would satisfy? We were doing live YouTube today, so wouldn't that satisfy the public requirement? I asked somebody that question last week, and I forgot whether it was
I'd have to look.
Representative Eisenhardt. I think he's asked for state. So, one of the things on the West Campus is that Tom Berger mentioned this in the last couple days. His idea for if the EOC gets operated, he wants the West Campus room to be the press room and for press types of meetings and conferences, not to get them involved in operations. So if the EOC gets operated, then the West Campus conference room is, at least that was his idea, to have that be more of a press room. So we could wait until that conflict occurs. Otherwise, I don't know, I mean, I agree with you, Supervisor McDonough, this has never been a perfect forum, but we're gonna monitor limited, we're already agreeing on limiting courthouse access. We would just need to get public access, either by phone or by the internet, for these meetings. And then I don't anticipate a lot of people being here.
But I think, I'd like to have the opportunity for Mary to take notes remotely from home. I'd like her to be able to take our minutes. So that's gonna require her to have the ability to, we may have other people who wanna participate electronically as well. So I'd like to see us go to a place where that's available easily.
It's available here over the internet. You know, if you're talking about communication, we're limited to 6 lines. Nathan, are you still over there? We've got 6 lines. The public forum would be YouTube. So we're talking about public access in this room and communication related to the public.
Yes, so I've been pondering this more. So there's 2 ways to do it. We can do the 6 phone lines that are currently baked into this room. That works, we can do that, no problem. However, if we run the meeting from a machine that's plugged in, so this one, use that as Zoom, and then we have the room dial into the Zoom.
Okay.
It's almost unlimited then. I mean, we could have hundreds.
So you could send that notice to the public. They obviously have to.
We could meet electronically from our homes as well.
Absolutely, yes. Yeah, I'm gonna wanna test this, but there's no reason it won't work, because as we dial in from the room to Zoom.
I would propose that, we keep our venue here, you work out those kinks. If it doesn't work, we potentially could look at the West Campus immediately, but the comment was, and maybe you can confirm this, did Tom Berger want access to that as a press room or a?
I was with Tom for a lot of the morning, working with his AV stuff. He did not mention West Campus to me at all.
He had mentioned it to me Friday or I forget what day. But either way, I think we should stay here. And if you can accommodate the public through Zoom, and other methods, it makes sense.
I think for the next meeting.
We'll test it tomorrow, yeah.
For sure, we should have it here because we're getting a report from county staff, from security. But I'm willing to look at the West Campus as long as it's not infringing on what Tom Berger needs out there. So I'm willing to look at it, moving it out there, if we can satisfy the public need. So I'm willing to take a look at that.
So
West Campus will absolutely work.
Okay.
But I think this will too.
I think we need to, I'll check, when we're done, I'll check with Cheese and see if he tells me, Dave, I need that space reserved, then I think our only other option is here. I don't think the conference room at the old jail is I think we're better off here than there, so.
There is nothing in the conference
Okay,
room with the old
yeah,
jail.
so,
No one.
I can't think of any other.
What about time? We talked, I think we got Monday, Wednesday, Do we want to do a set time and get a set cadence over the next 4 weeks, and if so, what time?
Is, 1 o'clock,
Does it help staff if we get a little more time, just so you can kind of collaborate with each other, understand what you're doing, and then come to the board? Or does it better off if we start at 8 AM? I'm just trying to understand what would be better logistically for you.
I think for this Wednesday, it may be beneficial. We'll probably have a lot of headaches and hurdles Wednesday.
Okay. So you're saying Wednesday? I'm okay with 10, so Wednesday at 10? and
Wednesday
then-
at 10,
and
and
then-
does that sound
And then
okay?
do you wanna set them for the next dates, or just take it on Wednesday and try to do it then?
I'm asking Supervisor McDonough if 10 o'clock Wednesday
I
sounds
said
okay.
yes.
Okay, so 10 o'clock Wednesday, and then you want, have an agenda item for the go forward? We got,
If we could set the dates and times, it would be helpful to have.
Okay.
The department heads participate, either listening in or.
okay.
How about Monday, Wednesday, 10?
Do we know what time Patrice's conference calls are, that type of? So what do you think about 1:30 then? 1 or 1:30,
I don't care either.
so then we can get the,
Well,
I
so you don't-
understand that.
don't interrupt lunch or what?
no, I'm more thinking about giving Patrice a chance to be on her conference call.
I think you,
We're gonna start at 10.
well,
Wednesday.
This Wednesday.
I was just saying overall, do we want to set the agenda overall? If not, we can just drop the conversation. Sometimes getting a cadence helps people understand when we're meeting, and so then they can get agenda items to us.
Okay.
And so,
I don't
I just
ha-
threw out Monday,
don't ha-
Wednesday, 10 o'clock.
I don't have a strong preference, I just, was trying to figure out if,
I think that's gonna be a hard thing to guess.
Okay.
But, I mean, and we are gonna meet as a work session with the Board of Health, so we'll get that.
Tom, how about the Board of Health? What, do you know what's best for them? Do we,
Patrice just said after 9 o'clock.
after 9 o'clock, so 10 o'clock would work then. Okay, let's go with 10 AM, Monday and Wednesday for the next, I would say 4 weeks.
Okay, I'm comfortable with that.
Would we have any interest in having her have the option to call in?
Whatever form, yes.
Throw a curveball here, on our meeting day, will that just be a work session, COVID-19 work session then?
Yeah, we'll just leave it.
Okay,
That's what I would
it may or may not be right at 10 o'clock then on,
Because I know we'd have better attendance from the entire board if they could call in.
okay.
Exactly.
So Dawn, on a meeting, a morning meeting, we may not be done at 10. Right, 9 o'clock meeting,
Oh, so for our regular Monday meeting.
yeah. I mean, we could be wishful and schedule it at 10, but then I would suggest
I'll put specific.
leaving space for the after meeting then. Yeah,
And
We're
that's
trying to take a
also
lot off
public
of the
hearings.
okay,
Appropriate.
Also public hearings on the 23rd,
okay.
so we got.
I guess I'm talking about
23rd may be
the first meeting in April. It might depend,
may not be done at that time.
we might not be done quite at 10.
I'll pull those out
but-
separately.
Okay, all right, we got plenty of time to talk about it, all right. Okay, any other scheduling?
I do have two things. There has been questions about should my board or commission be meeting and does the Board of Supervisors have any recommendations? Supervisor McDonough brought it up. We currently have the hydrology study public input session scheduled for next Tuesday. I'm
Just
guessing
got
we're recommending
canceled.
to postpone
Is
that.
it canceled?
Eric
Eric
sent-
just canceled it.
Oh, he did cancel, okay. I told him
I
we
think
were
it's
gonna
the
talk about it.
24th, right?
Yes, it is, okay.
Yeah, so
Those to you. So when they come through the official notice and end up in front of you, how, what do you want us to do? So we're gonna hold that tomorrow night. Nathan's gonna work with me and get that done, through Zoom. We're gonna work with, we only have 4 board members are gonna go on that, and so we're gonna try to do that through that tomorrow night. Short notice, but we're gonna try to figure it out. I just know that those cases then eventually come in front of you, and so how do you want me moving them forward? Do you want me just to take this and put them on hold after this, or, just give me some input of what you'd like me to do?
We have our Monday evening meeting on the 23rd.
Mm-hmm. And on that one, currently, we only have an official notice and nothing else. So literally, that will not bring public into you.
So April would be the first time in our regular scheduled meeting that we
Yes.
do that.
And there would be cases from tomorrow night coming to you in April.
I'd like to see none of that come before us until April 15th, mid-April. Let's get time for this to see the direction and see where we are, because I don't want, the public is going to feel they need to be here because there'll be people involved in the cases and they'll have people who may have comment. So I think as long as we, that would be my thought. If we're limiting public, we should limit also interaction with the public on cases that can be delayed for a longer period of time if they're comfortable with it.
And that's why I need your direction, so by tomorrow night, I'll be able to tell people that we would not move it forward automatically.
I'm okay postponing those as well.
Okay.
And so if April 15th is the date you propose, I would support that.
Okay, I just wanted your input on that, okay?
I think we have consensus on that.
Okay, good,
And
thank
then,
you.
Tammy, do you have any, do you know how, have a plan to handle if you have any controversial cases where you might have a crowd at another location?
We have no cases right now coming in front of us. I will have to put a plan into place for that. Honestly, Dave, I haven't had a moment to think about that, but I will now.
Okay.
And think about how we would handle that situation, and maybe working with Nathan and talk with him what advice he might give on that too, as far as holding a public meeting like you guys are.
Can you just postpone the cases?
Zoning is not life-threatening stuff, so,
Well,
yes.
some folks need to move forward with zoning
They-
because
they
they're
need to
making
move.
development plans and
Right.
they have money invested, and so time is important to them
Yeah,
to move forward, and
I
those
agree.
cases are different.
Yeah, I agree. We'll just have to keep trying to work with everybody and try to work this through.
Correct.
Okay.
Okay, thank you.
I think you'll do this well.
Okay, other meeting schedules, issues.
That's all I had.
Okay, thank you. Next up, communication plan.
I don't have a whole lot for that. And actually, after today, I think that may be better for Wednesday as I work with the department heads tomorrow.
I would like to ask my colleagues, like letters that come. We need that, anything that's coming before us like that, as soon as possible. Direction that childcare people are gonna be here, anything like that, anything that's possible that there's gonna be comment or time. I think it's professional courtesy to each other. We can't do that without breaking quorum. We certainly can ask Dawn to facilitate that, to keep us up to date about what concerns are and what's happening, so that, we're not facing things that we've not seen before, and we're asking people to make immediate judgments on things. That the nature of this is going to be that it's unfolding constantly, but if we try to give each other the most notice we can, then that would be helpful. I think that's part of a communication plan. I know that Josh Jasper from Resources Unite is intending to be before us on Wednesday, because he told me there was a meeting on Wednesday, and I didn't even know there was a meeting on Wednesday.
Nor did I.
Right, so those things are.
There wasn't a meeting on Wednesday until just 10 minutes ago.
Well, he knew there was a meeting on Wednesday.
There wasn't a meeting scheduled until they're Wednesday. The board makes these decisions, so.
Well, he's contacted somebody,
I
and that's
spoke with
fine,
him.
he
I
can.
spoke with him and I said, I want to meet on Wednesday and I intend to have the board meet on Wednesday. But it's not official until we have that hearing.
Right.
So, that's how the governing body is here, makes those decisions. So don't, there's the thought that, hey, we were meeting on Wednesday. No, we weren't meeting on Wednesday until 5 minutes ago, this board decided.
So if I was gonna complete my thought on that, I would say that when we have someone who wants to meet before us, we should be communicating that to Dawn. I asked Josh specifically, I need to see whatever, he's bringing a plan to us, plans coming from food policy, from Resources Unite, plans coming from citizens that is all urgent, and it all is. But if we give each other the most notice we can, using our only resource, which is Dawn, I think it would help that we're better prepared.
I fully support that. Fully support, and it's, yes. Yes, but under normal conditions, so.
And I would I would just say this,
But
the,
if we have the
the
last 48 hours
childcare,
occur again, it's gonna be tough.
the childcare thing just happened. And that was done by the childcare providers.
I was shocked as well when it came in the room, like, oh my God, who are these people?
I mean, I didn't know, I knew we had a couple of them coming, but I didn't know we had a room full.
Well, we were gonna need to have somebody, we're not gonna be able to
Yeah.
fill the room with all
I-
these people.
I agree.
Well,
I
we're
agree.
limiting courthouse access,
Yeah.
so that's gonna be
If they wanna come up to a board meeting, they're gonna be allowed to come to a board meeting.
with an exception, with conditions, yes, not 100, not 50.
And it sounds like,
10.
Patrice was working on a structure and a point person, and I think that, obviously, when did they cancel? It was after the 10:30 news last night, wasn't it? Because I was watching a recorded version of the news, and I told my wife, it's not on there. She said, that's because it came out after the news, so, anyway.
Yeah, but I share, yeah, definitely if we can do, our best to communicate, that's helpful.
Yeah.
And, obviously not possible in the last 48 hours. It's moving pretty quick.
Yep. Okay, anything else regarding communication plan? That's gonna kinda happen Wednesday. Sounds like we got plenty on the agenda for
Can I
Wednesday.
ask who's gonna be in charge of updating the website with all of these things we've said are super critical? Who's in charge of that?
Probably
I will
departments and
I will
Karen.
work with IT. Karen in IT does
And
that,
social
so.
media, do we have any kind of coordinated effort to be doing anything with social media?
Just got our Facebook up last Friday, so I haven't had time to do it. We're
Could we
working
ask
on
the
Twitter.
assessor to help us in any way? He does have an active Facebook page.
Well, so do I.
Twitter,
So,
we don't have access to
I
it
have
yet.
both. I mean, there's a couple ideas if you wanted to talk about that. So we could go out to a community partner, have their site be rebranded, and you have their audience. It's not perfect, but would be Dubuque County, you know who they were. You can start from scratch. I think that's, if we don't have any other choices, you just start from scratch. We're obviously late in the game on this. Or you could just continue to have various sites, mine, yours, John's, CJ Mays, the sheriff's, and then just have information go there. And the other scenario would be you're relying on our community partners in the press, and that's the largest one is the Telegraph Herald, and or other radio outlets, and we just start pumping everyone to them. That's what happens now. Those are your scenarios. I don't know if I have a hard answer in my head. The current state of play is to rely on all the local radios and Telegraph Herald. Any comments or thoughts, or do you want to talk about it? So we could hypothetically, we're
If you're
on
looking-
camera, we could get Dubuque 365, you could try sending out around Iowa, you could try to get an agreement with them, you could rename it, and then that's your forum back to the public, and so you're kind of buying a media. You might, a hybrid of that would be to do it through TH, or the other things I said.
I'm wondering if we have any, as we limit public, if we'll have people even on our own staff who are working on the website change, see if we have anybody who's gonna have less work to do, and see if there's someone there that might wanna step into those shoes.
Yeah, I mean, the website's nice, it's not where people go anymore. So social media related to Facebook Live, Twitter, and YouTube are the dominant resources. And so we are on YouTube, so that's good. So that was a good change. We're behind the 8 ball on Facebook and Twitter. They're non-existent.
What did you need, John?
Processes to deal with the changes in the building that affected noon on Wednesday?
Absolutely. Yeah, support that. So maybe we'll put on an agenda for Wednesday with social media. If we do nothing, it's, thank you, TH. I read your stuff every day, and you're online, and you're on Facebook, you're on Twitter, and I know you cover this, so thank you. It's times like this where you really appreciate the press.
I, speaking for myself, don't want to be in the lead on this. as far as technology goes. Although I do have 1,500 Facebook friends. You'll learn a lot about my grandkids and great-grandkids.
We bought a package. We have somebody who's in charge of bringing in and bringing all these things online, and it started July 1st of last year, the fiscal year, I believe, right?
We also could buy users, so if we wanted to spend 10 grand, we could have probably 10,000 users in a week. We just write a check to Facebook, so that's what they do.
I guess what I'd like to have is maybe an update on the website, social media piece that we've been bringing in. I don't even know where it's not an urgent issue to me about where we are with the website redesign. I think we are in the midst of that. We are all working on that.
I believe the live date was going to be April 1st before this.
So that's the reason to ask. It's
Yeah.
like, I think
He had
we're
asked for a work
getting to
session on the
there.
9th, and I had to
So
push it off, so.
let's-
All right, it's getting real.
Okay.
Archdiocese of Dubuque's canceling masses.
I think, yeah.
Canceling masses?
Yeah, I think we've reached the point.
I did
That's the holy
television
grail.
mass yesterday.
I think if we all
Time
go
in
home
2,000
tomorrow,
years.
many of these decisions will already.
Yeah, some of them.
They're always ahead of us.
Like I said, look what happened from Friday to today, so.
Motion
Okay,
to adjourn
anything
until
else?
Wednesday.
Wednesday
Mary,
at
would it be a
Wednesday.
recess or adjournment? You have a meeting
We still have a
scheduled,
meeting scheduled.
recess,
Motion to recess until
Wednesday. Is
Wednesday at 10.
there
I
a
will
second?
second that.
Okay, any discussion? All in favor signify by saying aye.
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 Thank you all.
Good meeting,
Good patience, thank you.
necessary meeting, unfortunately. Okay, and you got some more stuff. Is that the list then?